If you are a proud kitten owner or planning to adopt a kitten soon, understanding their sneezing habits is an essential part of keeping your little friend healthy and happy. Sneezing in kittens can be cute, funny, and sometimes alarming, especially if you don't know what's normal and what could indicate a health problem. In this chapter, we will explore the common causes of sneezing in kittens, the signs to watch for, and the first steps you can take to ensure your kitten stays healthy. Firstly, it's important to know that sneezing is a normal reflex in kittens. Just like humans, kittens sneeze to clear irritants from their noses, such as dust, pollen, or tiny particles that may enter their nasal passages. When a kitten sneezes occasionally and seems otherwise healthy, playing, eating, and sleeping normally, it is generally not a cause for concern. These little sneezes are often harmless and part of their natural defense mechanism. However, frequent or intense sneezing can sometimes signal underlying health issues. One of the most common reasons kittens sneeze excessively is upper respiratory infections, often caused by viruses or bacteria. Upper respiratory infections, sometimes referred to as cat colds, are especially prevalent in young kittens whose immune systems are still developing. These infections can be caused by feline herpes virus, calicivirus, or other contagious pathogens. Kittens in shelters, breeders, or multi-cat households are at higher risk due to close contact with other cats. The symptoms of an upper respiratory infection often go beyond sneezing. You may notice watery eyes, nasal discharge, coughing, and even a decrease in appetite. In more severe cases, kittens may have difficulty breathing, lethargy, or fever. If your kitten exhibits any of these signs, it is crucial to contact a veterinarian immediately. Early intervention can prevent complications and help your kitten recover faster. Apart from infections, environmental factors also play a significant role in triggering sneezes. Dusty bedding, household cleaning products, strong perfumes, or even pollen from outdoor plants can irritate a kitten's sensitive nasal passages. If your kitten sneezes primarily in a certain area or after exposure to specific substances, consider changing their environment or using mild, kitten-safe cleaning products. Regular cleaning of their bedding and living area can help minimize irritants and create a healthier environment. Another factor that sometimes goes unnoticed is allergies. Although less common than in adult cats or humans, kittens can develop allergies to things like certain foods, dust mites, or pollen. Sneezing due to allergies is often accompanied by other signs such as watery eyes, itching, or coughing. If you suspect your kitten has allergies, consult your veterinarian. They may recommend specific treatments, dietary changes, or environmental adjustments to reduce symptoms. It's also important to pay attention to foreign objects in the nasal passages. Kittens are naturally curious and may sniff or explore small items that can become lodged in their nose, such as tiny pieces of paper, plant seeds, or small toys. A foreign object can cause sudden sneezing, nasal discharge, or even bleeding. If your kitten shows signs of discomfort, pawing at their nose, or persistent sneezing, a veterinarian can safely check and remove any obstruction. Interestingly, some kittens may sneeze simply due to sudden temperature changes or drafts. Young kittens are sensitive to cold air, and exposure to a chilly breeze or an air-conditioned room can trigger occasional sneezing. These sneezes are usually mild and don't indicate illness. Ensuring your kitten's sleeping area is warm and draft-free can help reduce these minor episodes. When monitoring your kitten, keep a record of their sneezing habits. Note the frequency, duration, and any accompanying symptoms such as discharge, coughing, or lethargy. This information can be invaluable if a veterinary visit becomes necessary. Routine health checks with a veterinarian are also essential for early detection of any underlying conditions. Vaccinations, deworming, and proper nutrition all play a critical role in supporting your kitten's immune system and preventing infections. Finally, let's talk about comforting your sneezing kitten. Kittens are delicate, and excessive sneezing can make them feel irritable or stressed. Gentle petting, providing a warm and clean environment, and keeping them hydrated are simple but effective ways to help them feel better. Always ensure that your kitten has access to fresh water and nutritious kitten food, as a strong immune system is key to fighting off infections and recovering quickly. In summary, occasional sneezing in kittens is usually harmless and part of their natural behavior. Frequent or severe sneezing, however, can indicate infections, allergies, irritants, or foreign objects in the nose. By paying close attention to your kitten's behavior, keeping their environment clean, and seeking veterinary advice when necessary, you can ensure your little friend stays healthy, happy, and playful. Understanding why kittens sneeze is the first step in becoming a responsible and caring pet owner. In the next chapter, we will dive deeper into specific types of upper respiratory infections, how they are transmitted, and what treatments are available. Understanding these infections will help you prevent serious health issues and give your kitten the best start in life. Welcome back to our guide on kitten sneezing. In this chapter, we will focus on one of the most common reasons kittens sneeze frequently, upper respiratory infections, often called URIs or cat colds. Understanding these infections is crucial for any kitten owner, as early recognition and care can prevent complications and keep your kitten healthy and happy. Upper respiratory infections are caused by viruses, bacteria, or a combination of both, and they affect the nose, throat, and sometimes the eyes of kittens. The most common viral culprits are feline herpes virus type 1, FHV1, and feline calicivirus, FCV. Both viruses are highly contagious, especially among kittens whose immune systems are still developing. In addition, bacterial infections, often caused by Bordetella bronchoseptica or Chlamydophila felis, can occur alone or as a secondary infection following a viral illness. Kittens are particularly vulnerable to URIs because their immune systems are immature. This is why kittens from shelters, breeders, or multi-cat households often experience sneezing outbreaks. Stress, poor nutrition, and exposure to other sick cats can further increase the risk. Recognizing the early signs of a URI can help you take action before the illness becomes severe. The most common symptoms of a URI include frequent sneezing. Sneezing is often the first noticeable sign, ranging from occasional to continuous bouts. Nasal discharge. This may start as clear and watery but can become thick, yellow, or green as the infection progresses. Watery eyes. Kittens may have teary eyes, redness, or swelling around the eyelids. Coughing or gagging. Some kittens may develop mild coughing due to throat irritation. Loss of appetite. URIs can make kittens feel lethargic and less interested in food. Fever and lethargy. In more severe cases, kittens may appear weak, sleep more than usual, or have an elevated body temperature. It's important to note that while occasional sneezing can be harmless, persistent sneezing with other symptoms usually indicates a URI and warrants veterinary attention. Early care not only reduces discomfort but also lowers the risk of serious complications, such as pneumonia or chronic sinus issues. Transmission of URIs is relatively easy among kittens. The viruses and bacteria responsible spread through direct contact with infected cats, shared food or water bowls, contaminated bedding, and even airborne droplets from sneezing or coughing. This is why isolating sick kittens and maintaining good hygiene is crucial in multi-cat environments. Regular cleaning of litter boxes, bedding, and toys can help prevent the spread of infection. Now, let's talk about early care at home. While veterinary guidance is essential, there are several steps you can take to help your kitten recover comfortably. Keep your kitten warm and comfortable. Young kittens can lose body heat quickly when sick. Provide soft bedding in a warm, draft-free area to help them feel secure. Ensure proper hydration. URIs can lead to dehydration, especially if kittens are not eating or drinking enough. Offer fresh water frequently, and consider adding kitten-safe broths to encourage fluid intake. Assist with feeding. If your kitten's appetite is low, try offering soft, palatable foods, or slightly warming wet food to make it more enticing. Small, frequent meals can help maintain energy levels. Clear nasal discharge. Gently wipe away discharge with a damp, soft cloth. Some kittens may benefit from a vaporizer or humidifier nearby, as moisture in the air can help ease nasal congestion. Monitor for worsening symptoms. Keep track of sneezing frequency, discharge color, energy levels, and appetite. Any sudden changes, like labored breathing or persistent fever, require immediate veterinary attention. Vaccination plays a critical role in preventing URIs. Core vaccines for kittens, including those protecting against feline herpes virus and calicivirus, significantly reduce the severity of illness and the likelihood of complications. Discussing a proper vaccination schedule with your veterinarian ensures your kitten is protected from these common infections. Some kittens may also develop secondary bacterial infections following a viral URI. Symptoms of bacterial complications may include thicker nasal discharge, persistent cough, or worsening lethargy. In these cases, veterinarians may prescribe antibiotics or supportive treatments. It's important not to give antibiotics at home without veterinary guidance, as incorrect use can be harmful. Aside from medications, environmental management is equally important. Keeping your kitten's living space clean, avoiding exposure to sick cats, and reducing stress are all key factors in recovery. Stress can suppress the immune system and prolong illness, so gentle handling and a quiet, comfortable environment are essential. Remember, prevention is always better than cure. Regular health checks, proper vaccinations, a balanced diet, and minimizing exposure to infectious agents are the best strategies to keep your kitten healthy. Understanding URIs empowers you as a kitten owner to act quickly, provide supportive care, and seek veterinary advice when necessary. By staying informed, attentive, and proactive, you can help your kitten navigate the challenges of upper respiratory infections safely. In the next chapter, we will explore home remedies and supportive care that complement veterinary treatment, helping your kitten recover faster and stay comfortable during illness. Welcome to Chapter 3 of our comprehensive guide on kitten sneezing. In this chapter, we will explore practical ways to care for your sneezing kitten at home, safe remedies to ease their symptoms, and when it's crucial to seek veterinary help. As a responsible kitten owner, understanding how to provide supportive care can make a significant difference in your kitten's comfort, recovery, and overall health. When your kitten starts sneezing frequently, it's natural to feel worried. While some sneezes are harmless, persistent sneezing can indicate irritation, allergies, or an upper respiratory infection. The good news is that many mild cases can be managed at home with proper care, attention, and hygiene, creating a safe and comfortable environment. The first step in helping your sneezing kitten is ensuring their environment is clean, warm, and stress-free. Young kittens are particularly sensitive to drafts, cold floors, and loud noises. A warm, quiet space reduces stress and supports their immune system in fighting off infections. Consider using soft blankets, a small bed in a draft-free corner, or even a heated pad designed for kittens. Always ensure that the heating source is safe and that your kitten can move away from it if they get too warm. Air quality is another critical factor. Dust, pollen, strong cleaning products, cigarette smoke, and even scented candles can irritate a kitten's nasal passages. Minimizing these irritants can reduce sneezing episodes. Using a humidifier or vaporizer in the room can help maintain moisture in the air, which is especially beneficial if your home has dry air. Moist air helps loosen congestion and makes breathing more comfortable for your kitten. Nutrition and hydration. Proper nutrition plays a key role in supporting your kitten's recovery. Sneezing or illness may reduce their appetite, but it's important to encourage eating. Offer soft, wet food that is slightly warmed to make it more enticing. Small, frequent meals are easier for kittens to manage, and ensuring they continue to eat will help maintain energy and support their immune system. Hydration is equally vital. Kittens can become dehydrated quickly if they have a nasal infection, especially if they aren't drinking enough water. Always provide fresh, clean water, and consider supplementing with kitten-safe broths or electrolyte solutions recommended by your veterinarian. Avoid giving cow's milk, as many kittens are lactose intolerant and it can worsen digestive issues. Nasal care and hygiene. One of the most helpful things you can do at home is gently clearing your kitten's nasal passages. Use a soft, damp cloth to wipe away discharge from the nose. For more stubborn congestion, a saline solution recommended by a vet can help loosen mucus. Simply apply a few drops in each nostril and gently wipe away any loosened discharge. This helps your kitten breathe more easily and reduces irritation. Regular grooming is also important. Brushing your kitten removes loose fur and reduces dust particles that could trigger sneezing. Keep their bedding clean, wash blankets regularly, and make sure litter boxes are hygienic. Reducing environmental irritants supports faster recovery. Safe home remedies. While it's essential to consult a veterinarian for proper diagnosis and treatment, certain safe home remedies can complement professional care and ease your kitten's discomfort. Humidifier or steam therapy. Place your kitten in a warm, humid room or use a vaporizer nearby. The moisture in the air helps to relieve nasal congestion. A brief time in a bathroom with a hot shower running, but keeping the kitten at a safe distance, can also have similar benefits. Honey, for older kittens, with vet approval, small amounts of honey can sometimes soothe throat irritation. Do not give honey to kittens under 6 months without veterinary guidance, as their digestive system is still delicate. Gentle massage. Massaging the kitten's throat and around the sinuses gently can help promote drainage and reduce discomfort. Always be soft and cautious. Elevated feeding. Raising food and water bowls slightly can help kittens with congestion breathe easier while eating or drinking. Reduce stress. Stress can worsen sneezing and prolong recovery. Spend time with your kitten, provide gentle petting, and maintain a calm environment. Stress reduction is often underestimated, but is crucial for healing. When to seek veterinary care. While many cases of mild sneezing can be managed at home, certain signs require immediate veterinary attention. Persistent or worsening sneezing with thick yellow or green nasal discharge. Difficulty breathing, wheezing, or loud coughing. Loss of appetite for more than a day or two. Lethargy or unusual weakness. Swelling around the eyes or nose, or discharge that smells foul. Fever or sudden change in behavior. Veterinarians can prescribe treatments such as antiviral medications, antibiotics for secondary infections, or supportive care like fluid therapy. Early intervention often prevents complications and ensures a faster recovery. Monitoring and tracking your kitten's health. Keeping a daily record of your kitten's sneezing, appetite, activity level, and other symptoms is highly beneficial. This log can help you detect patterns, identify triggers, and provide valuable information for your veterinarian. Note details such as time of day sneezing occurs, frequency and severity of sneezes, appearance and color of nasal discharge, appetite and water intake, energy and playfulness levels. Monitoring allows you to respond quickly if symptoms escalate, ensuring your kitten receives timely care. Preventive measures for the future. Once your kitten recovers, preventive care is essential to reduce the likelihood of future sneezing episodes. Key preventive measures include vaccinations. Core vaccines protect against feline herpes virus and calicivirus. Follow your veterinarian's recommended schedule. Regular vet checkups. Routine exams help detect health issues early. Good hygiene. Regularly clean bedding, toys, litter boxes, and feeding areas. Reduce exposure to sick cats. Limit contact with other cats that may be infected. Healthy diet and immune support. High-quality kitten food and proper nutrition strengthen immunity. By combining preventive care, proper hygiene, and attentive home care, you can significantly reduce sneezing episodes and help your kitten grow up healthy and playful. Conclusion. In summary, home care for sneezing kittens focuses on comfort, hygiene, hydration, nutrition, and safe supportive remedies. While occasional sneezing is normal, persistent or severe symptoms should never be ignored. With proper attention, a warm and clean environment, and close monitoring, most kittens recover well from mild upper respiratory issues. The next chapter will focus on allergies and environmental triggers, why some kittens sneeze even in the absence of infections, how to identify allergens, and what changes you can make in your home to keep your kitten healthy and sneeze-free. Understanding these triggers will empower you to create the safest and most comfortable environment for your furry friend. Welcome to Chapter 4 of our complete guide on kitten sneezing. In this chapter, we will explore allergies and environmental triggers, which are often overlooked but can cause frequent sneezing in kittens even when there is no infection present. By understanding these triggers, you can create a safe, healthy, and comfortable environment for your kitten and reduce unnecessary discomfort. Kittens, like humans, can develop sensitivities to certain substances in their environment. Sneezing caused by allergies or irritants is usually not contagious, but it can be persistent and irritating for your kitten. Allergic reactions can sometimes mimic symptoms of an upper respiratory infection, such as watery eyes, nasal discharge, or mild lethargy. This makes it essential for owners to identify the triggers and take preventive measures. Common environmental triggers. Environmental factors are among the most common causes of sneezing in kittens. These triggers include dust and dust mites. Dust accumulates easily in homes, and dust mites are a frequent allergen. Kittens are particularly sensitive to these tiny particles, which can irritate their nasal passages and lead to sneezing. Regular cleaning, vacuuming, and using dust-free bedding can significantly reduce this trigger. Pollen. Outdoor plants, flowers, and even trees can release pollen that settles on your kitten's fur. When kittens groom themselves, they may inhale or ingest these particles, causing sneezing and watery eyes. Limiting outdoor exposure during peak pollen seasons or gently wiping your kitten's paws and fur after outdoor play can help. Smoke and strong odors. Cigarette smoke, incense, scented candles, and even strong cleaning chemicals can irritate kittens' sensitive noses. Avoid exposing kittens to these substances, and opt for kitten-safe cleaning products whenever possible. Perfumes and air fresheners. Strong fragrances from household sprays, perfumes, or essential oils can trigger sneezing. Some essential oils are toxic to cats, so it's best to keep these out of reach. Mold and mildew. Damp areas in the home, such as bathrooms, basements, or areas with poor ventilation, can harbor mold spores. These spores can irritate your kitten's respiratory system and trigger sneezing. Ensuring proper ventilation and cleaning damp areas regularly can prevent this issue. Food allergies. Although less common in young kittens, food allergies can also contribute to sneezing and respiratory irritation. Common allergens include certain proteins like beef, chicken, or dairy products. In addition to sneezing, food allergies may cause digestive issues, skin rashes, or excessive grooming. If you suspect a food allergy, consult your veterinarian about an elimination diet, which can help identify the offending ingredient. Signs that your kitten might have allergies. It's important to distinguish sneezing caused by allergies from other causes like infections. Some signs that suggest allergies include sneezing primarily in certain areas or after exposure to specific substances, persistent watery eyes without thick nasal discharge, itchy skin, redness, or excessive scratching, mild lethargy without fever or other signs of infection, coughing or wheezing triggered by dust or strong odors. Recognizing these patterns can help you take steps to minimize exposure to allergens and improve your kitten's quality of life. Creating an allergy-friendly environment. Once you identify potential allergens, taking preventive measures can significantly reduce sneezing episodes. Regular cleaning, vacuum floors, furniture, and curtains frequently to remove dust and pollen. Wash bedding at least once a week using mild, fragrance-free detergents. Air purifiers. Using a HEPA air purifier can help remove airborne allergens, such as dust mites, pollen, and pet dander. Place the purifier in areas where your kitten spends the most time. Minimize carpet and fabric dust traps. Carpets, rugs, and fabric furniture can trap dust and pollen. Consider using washable rugs and furniture covers that can be cleaned regularly. Proper ventilation. Open windows occasionally to circulate fresh air, but avoid times of high pollen count. Ensure bathrooms and basements are dry and well ventilated to prevent mold growth. Safe toys and bedding. Choose toys, bedding, and scratching posts made from hypoallergenic or easily washable materials. Avoid scented or treated products that may irritate your kitten. Limit outdoor exposure. Outdoor allergens like pollen or grass can trigger sneezing. Supervised outdoor play or indoor play areas can reduce exposure while still providing stimulation and exercise. Managing allergies with veterinary support. Even with environmental adjustments, some kittens may continue to sneeze due to underlying allergic reactions. Veterinarians can provide guidance and treatment options, which may include antihistamines. Some antihistamines are safe for kittens under veterinary supervision and can reduce sneezing caused by allergies. Nasal sprays or drops. Veterinarians may recommend saline or medicated nasal sprays to relieve congestion. Immune support. Supplements or prescription diets may help strengthen the immune system and reduce allergic responses. Long-term management. Identifying and minimizing exposure to allergens is often the most effective long-term strategy. Monitoring your kitten. Careful observation is essential when managing allergies. Keep a diary of sneezing episodes, noting time of day and location. Possible triggers, new cleaning products, outdoor exposure, new foods. Severity and duration of sneezing. Any additional symptoms such as itching, coughing, or watery eyes. This record will help you track progress and provide valuable information for your veterinarian if further intervention is needed. Comfort and support for your kitten. In addition to minimizing triggers, providing comfort and support can significantly improve your kitten's well-being. Create cozy rest areas. Soft bedding, warmth, and quiet spaces help kittens rest and recover. Hydration and nutrition. Continue offering fresh water and nutritious, high-quality kitten food to support their immune system. Gentle interaction. Spend time with your kitten, but avoid overwhelming them if they seem irritated or stressed. Observation during play. Watch for sneezing or irritation during playtime, especially if using new toys or entering new areas. Conclusion. Allergies and environmental triggers are often underestimated causes of sneezing in kittens. By carefully observing your kitten, identifying potential allergens, and taking proactive measures, you can significantly reduce sneezing episodes and improve your kitten's quality of life. Creating a clean, safe, and low-stress environment, combined with veterinary guidance when necessary, ensures your kitten remains healthy, happy, and playful. In the next chapter, we will discuss long-term care strategies and preventive health measures, including vaccinations, routine vet visits, and lifestyle adjustments, to ensure your kitten grows into a strong, sneeze-free adult cat. By implementing these strategies, you will be prepared to provide the best care for your kitten throughout their life. Welcome to Chapter 5 of our comprehensive guide on kitten sneezing. In this chapter, we will focus on long-term care, preventive health strategies, and maintaining a sneeze-free life for your kitten. While understanding sneezing causes, home remedies, and environmental triggers is essential, long-term prevention is equally important to ensure your kitten grows into a healthy adult cat. The importance of preventive care. Preventive care is the foundation of a healthy life for kittens. Sneezing can often be an early indicator of underlying health issues, so maintaining regular checkups and vaccinations is crucial. Preventive healthcare not only reduces the risk of upper respiratory infections but also protects against other serious diseases, strengthens the immune system, and promotes overall well-being. Vaccinations for kittens. Vaccinations are among the most effective tools in preventing illnesses that can cause sneezing, especially upper respiratory infections. Core vaccines recommended for kittens include feline herpes virus, FHV1, vaccine, protects against one of the most common viral causes of sneezing and upper respiratory infections. Feline calicivirus, FCV, vaccine, protects against another major viral cause of sneezing, mouth ulcers, and respiratory symptoms. Feline panleukopenia, FPV, vaccine. Although primarily for digestive health, a strong immune system helps resist secondary infections. Rabies vaccine, required by law in many areas and essential for preventing a fatal disease. Kittens usually begin their vaccination schedule at around 6 to 8 weeks of age, with booster shots every 3 to 4 weeks until they are about 16 weeks old. Your veterinarian will tailor a vaccination plan based on your kitten's health, lifestyle, and risk factors. Routine veterinary checkups. Regular veterinary visits are critical for long-term preventive care. During checkups, veterinarians assess your kitten's overall health, monitor growth, and detect early signs of illness, including respiratory issues. Routine exams typically include physical examination of the eyes, nose, mouth, ears, and throat, assessment of weight, growth, and body condition, heart and lung evaluation, vaccination review and updates, parasite control recommendations, including deworming and flea prevention. These visits provide an opportunity to discuss any sneezing episodes, environmental concerns, or behavioral changes you may have noticed. Early intervention can prevent minor issues from becoming serious health problems. Nutrition for long-term health. Proper nutrition is essential for building a strong immune system and preventing illnesses that can cause sneezing. Kittens require high-quality, protein-rich food specifically formulated for their growth and development. Key aspects of kitten nutrition include balanced diet. Ensure the food provides the right mix of protein, fat, vitamins, and minerals for healthy growth. Hydration. Fresh water should always be available, and wet food can help increase fluid intake, especially if your kitten is prone to upper respiratory issues. Avoid overfeeding. Obesity can weaken the immune system and increase the risk of infections. Monitor portion sizes and maintain a healthy weight. A strong immune system helps your kitten resist infections, recover faster from illnesses, and stay sneeze-free in the long term. Parasite prevention. Parasites, including fleas, ticks, and intestinal worms, can indirectly contribute to sneezing by weakening your kitten's health or triggering allergic reactions. Your veterinarian can recommend safe preventive treatments for kittens, including monthly flea and tick preventives, deworming schedules appropriate for age and environment, monitoring for signs of infestation, such as itching, hair loss, or visible worms in stool. Maintaining parasite control is a vital part of overall preventive health and helps reduce respiratory stress caused by weakened immunity. Maintaining a clean and safe environment. A clean, allergen-free, and low-stress environment supports long-term respiratory health. Key steps include regular cleaning, wash bedding, toys, and litter boxes frequently. Vacuum carpets and furniture to reduce dust, pollen, and other irritants. Air quality management. Use HEPA air purifiers to minimize airborne allergens. Avoid cigarette smoke, scented sprays, and harsh chemicals. Mold prevention. Ensure proper ventilation in damp areas like bathrooms and basements. Remove mold promptly if found. Safe outdoor play. Limit exposure to pollen, grass, and other outdoor irritants. Supervised outdoor time or indoor play areas can provide stimulation without environmental risks. Managing stress and socialization. Stress can weaken a kitten's immune system, making them more susceptible to respiratory infections. Socialization, playtime, and a calm environment are essential for long-term health. Tips for managing stress include gentle handling and petting to build trust. Consistent daily routines for feeding, play, and rest. Quiet spaces where the kitten can retreat and feel safe. Gradual introduction to new people, pets, or environments. By reducing stress, you help your kitten's body fight off infections and minimize sneezing episodes caused by environmental or immune-related triggers. Recognizing early warning signs. Even with preventive care, it's important to recognize early warning signs of illness. Some signs that your kitten may need prompt veterinary attention include persistent sneezing or coughing, thick, yellow, or green nasal discharge, labored breathing or wheezing, lethargy or sudden behavioral changes, loss of appetite or refusal to drink water. Prompt action can prevent minor respiratory issues from developing into chronic conditions. Early recognition and treatment are key to maintaining a sneeze-free and healthy life. Building a long-term health routine. A comprehensive long-term health routine for your kitten should include vaccinations and boosters. Follow your veterinarian's schedule for core and optional vaccines. Regular vet checkups. Annual or semi-annual visits help detect health issues early. Balance nutrition and hydration. Maintain a diet tailored to your kitten's age and health needs. Environmental management. Keep living spaces clean, allergen-free, and safe. Parasite control. Use preventive treatments for fleas, ticks, and worms. Observation and records. Track sneezing, behavior, and other health indicators to identify patterns or concerns early. By consistently following these steps, you create a solid foundation for your kitten's lifelong health and minimize the risk of sneezing and respiratory infections. Conclusion. Long-term care and preventive health strategies are the keys to ensuring your kitten grows into a strong, healthy, and sneeze-free adult cat. Vaccinations, routine veterinary checkups, proper nutrition, parasite control, a clean environment, and stress management all work together to support your kitten's immune system and overall well-being. By implementing these strategies, you are not only addressing immediate concerns related to sneezing but also promoting lifelong health. Preventive care, attention to environmental triggers, and early veterinary intervention ensure that your kitten enjoys a happy, comfortable, and active life. In the next chapter, we will focus on behavioral insights and playful activities for kittens, highlighting how a healthy, well-stimulated kitten is less likely to experience stress-related sneezing and develops into a confident, social adult cat. Welcome to Chapter 6 of our complete guide on kitten sneezing. In this chapter, we will explore how behavior, play, and stress management can directly impact your kitten's health, including sneezing episodes. A well-stimulated and emotionally balanced kitten is less prone to stress-induced sneezing, and understanding their behavior will help you create a supportive environment that promotes both physical and mental wellness. Understanding kitten behavior. Kittens are naturally curious, energetic, and playful. Their behavior is a combination of instinctual drives, environmental influences, and early socialization experiences. Sneezing itself can sometimes be triggered or exacerbated by stress, overstimulation, or sudden changes in their environment. By paying attention to your kitten's behavioral cues, you can prevent stress-related sneezing and maintain overall health. Common behaviors to observe include exploration. Kittens love to investigate new objects, spaces, and scents. While exploration is healthy, it can occasionally expose them to allergens, dust, or foreign particles that trigger sneezing. Supervise exploration and ensure areas are clean and safe. Playfulness. Play is essential for development and mental stimulation. Interactive play helps strengthen muscles, improve coordination, and reduce stress. Kittens who are bored or understimulated may exhibit anxiety, which can indirectly lead to sneezing. Grooming. Self-grooming is normal, but excessive grooming can indicate stress, irritation, or skin sensitivities. Observe for signs of over-grooming or pawing at the nose, which may signal discomfort related to sneezing. Social interaction. Kittens require positive interactions with humans, other cats, or pets. Lack of socialization can lead to stress, while gentle socialization helps them become confident, happy, and resilient. The role of play in health. Play is not just fun, it's a critical component of your kitten's physical and emotional health. Engaging in daily play sessions has several benefits. Stress reduction. Play allows kittens to release pent-up energy and reduce anxiety. Stress can suppress the immune system, making kittens more susceptible to respiratory infections and sneezing. Mental stimulation. Interactive toys, puzzle feeders, and training games keep your kitten mentally active. A mentally stimulated kitten is less likely to develop behavioral issues that may worsen stress-related symptoms. Physical exercise. Exercise strengthens muscles, promotes healthy weight, and supports overall immunity. Healthy kittens recover faster from illnesses and are less prone to complications from sneezing or respiratory infections. Bonding with owners. Playtime strengthens the bond between you and your kitten, building trust and reducing stress during handling, grooming, and veterinary visits. Some recommended play activities include interactive wand toys. These mimic prey and allow your kitten to chase, jump, and pounce safely. Laser pointers provide short bursts of energetic play, but always follow up with a tangible toy to satisfy hunting instincts. Puzzle feeders challenge your kitten to hunt for food, stimulating their mind and rewarding problem-solving skills. Soft balls or catnip toys encourage solo play while providing mental stimulation and physical activity. Stress management techniques. Stress can be a significant factor in sneezing kittens. Environmental stressors, loud noises, changes in routine, or introduction to new pets can trigger or worsen respiratory irritation. By managing stress proactively, you can minimize sneezing and improve overall well-being. Tips for stress management include consistent routine. Kittens thrive on predictability. Feeding, play, and rest should occur at regular times to reduce anxiety. Safe retreats. Provide quiet, cozy spaces where your kitten can retreat if overwhelmed. Elevated beds, covered boxes, or dedicated rooms can offer comfort. Gentle handling. Avoid sudden movements or loud voices, especially during play or grooming. Always use soft, reassuring tones. Gradual introductions. Introduce new pets, people, or environments slowly. Allow your kitten to approach at their own pace, reducing stress-related sneezing. Environmental enrichment. Offer scratching posts, climbing structures, and window perches to satisfy natural instincts and reduce boredom. Behavioral indicators of stress or discomfort. Recognizing behavioral signs of stress or discomfort is essential for timely intervention. Some signs to watch for include hiding or avoiding interaction, excessive grooming or scratching, aggression or irritability, loss of appetite or decreased playfulness, sneezing, pawing at the nose, or nasal discharge. By observing these indicators, you can adjust your kitten's environment, provide comfort, and prevent escalation of stress-related symptoms, creating a safe and stimulating environment. A balanced environment combines safety, enrichment, and comfort. Some practical steps include clean and allergen-free spaces, reduce dust, pollen, and other irritants that trigger sneezing. Toys and climbing structures. Provide a variety of toys and climbing areas to encourage physical activity and mental stimulation. Quiet zones. Designate areas where your kitten can rest without interruption. Controlled outdoor access. If providing outdoor play, supervise carefully and limit exposure to potential allergens. Interaction with other pets. If you have multiple pets, interactions should be gradual and supervised. Stress from inter-pet conflicts or overexcitement can lead to sneezing or other health issues. Techniques for safe introductions include scent exchange. Let pets sniff each other's bedding or toys before direct contact. Controlled meetings. Use a barrier, such as a baby gate, during initial introductions. Positive reinforcement. Reward calm, friendly behavior with treats and praise. Monitoring progress and adjusting care. Regular observation is key to maintaining your kitten's health. Keep track of frequency and intensity of sneezing, appetite, water intake, and energy levels. Interaction with toys and other pets. Responses to environmental changes or new stimuli. Documenting this information helps identify patterns and triggers, allowing you to make informed adjustments to your kitten's care routine. When behavioral issues require professional help. In some cases, behavioral stress may require guidance from a veterinarian or certified animal behaviorist. Indicators that professional intervention may be needed include persistent hiding or avoidance, aggression toward humans or other pets, severe anxiety during routine activities, recurrent sneezing or respiratory symptoms linked to stress. Professional guidance can provide strategies to reduce stress, improve behavior, and maintain long-term respiratory health. Conclusion. Understanding your kitten's behavior, providing enriching play, and managing stress are essential components of long-term health and sneeze prevention. Play stimulates both the mind and body, reduces stress, and strengthens the bond between you and your kitten. A well-stimulated, confident kitten is less likely to experience stress-related sneezing and is better equipped to handle minor illnesses when they arise. In the next chapter, we will discuss emergency care and when to seek immediate veterinary attention. By learning to recognize urgent signs, you will be prepared to protect your kitten from serious respiratory problems and ensure their continued growth and happiness. Welcome to Chapter 7 of our in-depth guide on kitten sneezing. In this chapter, we will cover emergency care and help you recognize the signs that indicate your kitten needs immediate veterinary attention. While many sneezing episodes are mild and manageable at home, some situations can escalate quickly, and prompt action is crucial to prevent serious complications. Understanding emergency situations. Kittens are small, delicate, and vulnerable, which means they can deteriorate quickly if an illness progresses. Sneezing in itself is not always an emergency, but when it's accompanied by severe symptoms, it can signal life-threatening conditions such as severe upper respiratory infections, pneumonia, or obstruction of the airways. Early recognition of these emergencies can save your kitten's life. Familiarize yourself with the signs that indicate urgent medical care is required. Critical symptoms to watch for. Some symptoms indicate that your kitten's condition is beyond home care and needs immediate veterinary attention. These include severe or labored breathing, rapid, shallow breaths, wheezing, or open-mouth breathing are all warning signs. Difficulty breathing can quickly become life-threatening in kittens. Persistent or bloody nasal discharge. Thick, yellow-green, or blood-tinged discharge indicates infection or possible injury. High fever. A kitten's normal temperature ranges from about 100.5 degrees Fahrenheit to 102.5 degrees Fahrenheit. A higher temperature may indicate a severe infection. Lethargy or collapse. Extreme weakness, unresponsiveness, or inability to stand are critical signs of distress. Loss of appetite or inability to drink. Dehydration can develop rapidly in kittens, leading to serious complications. Swelling or facial deformities. Swelling around the eyes, nose, or jaw may indicate abscesses, dental problems, or infections that need urgent treatment. Sudden behavioral changes, aggression, confusion, or extreme distress can signal pain or serious illness. If you observe any of these symptoms, contact your veterinarian immediately or go to an emergency veterinary clinic. Time is critical, especially with young kittens. Basic emergency care at home. While rushing to a veterinarian is the best action in severe cases, there are some supportive steps you can take at home to stabilize your kitten during transport. Maintain warmth. Sick kittens can lose body heat rapidly. Wrap them in a soft towel or blanket and keep them in a warm, draft-free environment during transport. Hydration. If your kitten is alert and able to swallow, offer small amounts of water. Avoid forcing fluids, which can cause choking. For dehydrated kittens, a veterinarian may administer fluids subcutaneously or intravenously. Clear airways. Gently wipe away mucus from the nose and mouth using a damp cloth. This can help your kitten breathe more easily while traveling. Calm environment. Reduce stress by speaking softly and minimizing sudden movements. Stress can worsen respiratory distress. Safe transport. Place your kitten in a secure carrier with padding to prevent injury during the trip to the clinic. These measures do not replace veterinary care, but they help stabilize your kitten and make emergency treatment more effective. Common emergency conditions associated with sneezing. Understanding the conditions that can lead to emergency situations helps you anticipate risks. Some common emergencies include severe upper respiratory infections. Infections caused by feline herpes virus, calicivirus, or secondary bacterial infections can lead to pneumonia if untreated. Rapid intervention is critical. Foreign body obstruction. Kittens may inhale small objects, dust, or plant matter that block the nasal passages. Obstruction can cause persistent sneezing, difficulty breathing, and nasal discharge. Immediate removal by a veterinarian is essential. Allergic reactions or anaphylaxis. Severe allergic reactions can cause swelling of the airway, difficulty breathing, vomiting, or collapse. This is a life-threatening emergency. Trauma or facial injury. Accidents or rough play may lead to nasal fractures, abscesses, or internal bleeding, requiring urgent veterinary evaluation. Severe dehydration or malnutrition. Kittens who are not eating or drinking due to illness or sneezing-related discomfort can quickly become critically ill. Preparing for veterinary visits. Being prepared for emergency situations ensures that your kitten receives timely and effective care. Here are some preparation tips. Know your vet's emergency contacts. Keep the number of your regular veterinarian and the nearest emergency veterinary clinic handy. Have a carrier ready. A safe, comfortable carrier allows secure transport. Line it with soft towels for warmth and cushioning. Document symptoms. Note when sneezing started, the frequency, any discharge, appetite changes, and other behavioral changes. This information helps the veterinarian diagnose the problem quickly. Avoid home medications without guidance. Never give human medications to kittens, as many are toxic. Only administer medications prescribed by a veterinarian. During the veterinary visit. At the clinic, the veterinarian may perform several assessments and interventions to stabilize your kitten and treat the underlying condition. Physical examination, checking temperature, weight, eyes, nose, mouth, throat, and lungs. Diagnostic tests, blood tests, nasal swabs, or imaging may be conducted to identify infections or obstructions. Medications, antibiotics, antivirals, anti-inflammatories, or other medications may be prescribed. Fluid therapy, intravenous or subcutaneous fluids may be given to address dehydration. Hospitalization. In severe cases, kittens may need overnight monitoring, oxygen therapy, or specialized care. Preventing emergency situations. Preventing emergencies is always better than reacting to them. Key strategies include regular health checkups. Early detection of respiratory issues or other illnesses reduces the risk of emergencies. Vaccinations. Keeping up with vaccines prevents infections that could lead to severe respiratory problems. Environmental safety. Remove small objects, toxic plants, and allergens that could trigger sneezing or airway obstruction. Immediate attention to symptoms. Addressing sneezing, nasal discharge, or lethargy early can prevent progression to severe illness. Stress reduction. A calm, predictable environment strengthens the immune system and reduces the likelihood of stress-related complications. Home observation after an emergency. After an emergency visit, continued observation at home is critical. Monitor your kitten for sneezing frequency and severity, appetite and water intake, energy levels and playfulness, side effects of medications or treatments. Maintain follow-up appointments with your veterinarian to ensure complete recovery and prevent recurrence of respiratory issues. Conclusion. Emergency care and prompt veterinary attention are essential for kittens experiencing severe sneezing, respiratory distress, or associated health problems. Recognizing critical symptoms, providing basic stabilization at home, and seeking immediate professional care can save your kitten's life. By combining emergency preparedness with preventive strategies, such as vaccinations, regular checkups, and a clean, low-stress environment, you can protect your kitten from serious health risks and promote long-term wellness. In the next chapter, we will discuss recovery, long-term health maintenance, and creating a comfortable, happy environment for kittens who have experienced sneezing episodes. Proper follow-up care ensures your kitten grows into a healthy, active adult cat with minimal respiratory issues. Welcome to Chapter 8 of our comprehensive guide on kitten sneezing. In this chapter, we will focus on the recovery process after sneezing episodes, strategies for long-term health maintenance, and how to create a comfortable and supportive environment for your kitten. Proper recovery and consistent care are essential to ensure that your kitten grows into a healthy, active, and sneeze-free adult cat. Understanding the recovery process. Recovery from sneezing and associated respiratory issues can vary depending on the underlying cause, severity of symptoms, and the kitten's overall health. For mild cases, recovery may take just a few days with proper home care. However, for more severe infections or after emergency situations, full recovery can take several weeks. Patience and consistent monitoring are crucial. During recovery, your kitten may exhibit reduced energy levels and more sleep than usual, occasional sneezing or mild nasal discharge, appetite fluctuations, sensitivity to environmental changes, such as new scents or dust. Recognizing these signs as part of the recovery process helps you provide the best supportive care while avoiding unnecessary stress. Nutrition during recovery. Proper nutrition is one of the most critical aspects of recovery. A kitten fighting off an illness or recovering from a respiratory infection requires high-quality, easily digestible food to support their immune system and regain strength. Soft, wet food. Moist food is easier for kittens to eat, especially if they have nasal congestion or reduced appetite. Warm slightly to enhance aroma and encourage eating. Frequent, small meals. Offering smaller portions several times a day can be more manageable and helps maintain energy levels. Hydration. Ensure fresh water is always available. Wet food and kitten-safe broths also help maintain hydration, which is vital for mucus clearance and overall recovery. Supplements. Under veterinary guidance, supplements such as probiotics, vitamins, or immune-supporting formulas may help accelerate recovery. Avoid giving human supplements, as some can be toxic to kittens. Medications and treatments. Follow your veterinarian's instructions for any prescribed medications during recovery. This may include antibiotics for secondary bacterial infections, antivirals if sneezing was caused by viral infections like feline herpes virus, anti-inflammatory medications to reduce nasal and throat irritation, supportive treatments, nasal drops, saline sprays, or topical ointments. Always complete the full course of prescribed medications, even if your kitten appears to be feeling better. Stopping treatment early can result in a relapse or prolonged infection. Environmental support during recovery. A comfortable, low-stress environment is critical for your kitten's recovery. Key considerations include warm and quiet spaces. Kittens recover faster in quiet, draft-free areas. Provide soft bedding, and consider a heating pad designed for kittens to maintain warmth. Clean air. Minimize dust, smoke, strong fragrances, and other irritants. Use air purifiers if necessary. Safe exploration. Allow your kitten to explore, but supervise to prevent contact with allergens, other pets, or small objects that could worsen symptoms. Gentle handling. During recovery, kittens may be more sensitive to touch. Handle gently to avoid stress, which can delay healing. Monitoring health during recovery. Keeping a daily record of your kitten's symptoms is extremely helpful. Track sneezing frequency and intensity, nasal discharge or congestion, appetite and water intake, energy levels and playfulness, responses to medications or environmental changes. This log provides valuable information for follow-up veterinary visits and helps you detect early signs of complications or relapse. Long-term health maintenance. Once your kitten has recovered from a sneezing episode, long-term health maintenance is essential to prevent recurrence and ensure overall well-being. Key aspects include vaccinations. Keep vaccinations up to date to protect against common infectious causes of sneezing, including feline herpes virus and calicivirus. Routine veterinary checkups. Regular exams help detect early health issues, monitor growth, and ensure your kitten remains healthy. Balanced diet. Maintain a high-quality, protein-rich diet appropriate for your kitten's age and growth stage. Hydration. Continue to provide fresh water daily and monitor for signs of dehydration. Parasite prevention. Use flea, tick, and worm preventives as recommended by your veterinarian. Environmental management. Maintain clean bedding, toys, and living spaces to reduce allergens and irritants. Behavioral and emotional health. Long-term health maintenance also involves behavioral and emotional care. Stress, boredom, and lack of stimulation can weaken your kitten's immune system and indirectly contribute to sneezing or other health problems. Play and exercise. Continue regular play sessions to stimulate both mind and body. Use interactive toys, climbing structures, and puzzle feeders. Social interaction. Ensure positive interactions with humans and, if applicable, other pets. Stress reduction. Provide safe retreats, consistent routines, and minimize sudden environmental changes. A confident, well-stimulated kitten is healthier and more resilient against infections and stress-induced sneezing. Preparing for future illnesses. Even with careful care, kittens may experience sneezing or respiratory issues in the future. Being prepared helps you respond quickly and effectively. Recognize early symptoms. Watch for changes in sneezing frequency, nasal discharge, or energy levels. Early intervention often prevents severe illness. Maintain emergency contacts. Keep your veterinarian and local emergency clinic numbers handy. Emergency kit. Include items such as a soft towel, carrier, saline solution, and any medications prescribed for your kitten. Preventive environment. Continue minimizing exposure to allergens, dust, and smoke. By being prepared and proactive, you can reduce the impact of future respiratory issues and protect your kitten's long-term health. Bonding and comfort. During recovery and long-term care, bonding with your kitten strengthens your relationship and provides emotional security. Simple actions that promote comfort and bonding include gentle petting and soothing talk, interactive play sessions, quiet cuddle time in soft bedding, providing safe spaces for rest and exploration. A calm, loved kitten is more likely to recover quickly from illness and maintain a healthy, happy life. Conclusion. Recovery from sneezing episodes in kittens requires consistent care, patience, and attention. Proper nutrition, hydration, medications, and a clean, low-stress environment are essential components of recovery. Long-term health maintenance, including vaccinations, routine checkups, behavioral enrichment, and preventive care, ensures your kitten grows into a strong, resilient adult cat. By combining supportive recovery strategies with preventive health measures and a comfortable, stimulating environment, you can help your kitten live a happy, active, and sneeze-free life. In the next chapter, we will discuss special considerations for kittens with chronic sneezing, including ongoing management, medical therapies, and lifestyle adjustments to ensure lifelong health and comfort. Welcome to Chapter 9 of our extensive guide on kitten sneezing. In this chapter, we will explore chronic sneezing, a condition where sneezing persists over weeks or months, and discuss strategies for ongoing management. We will also cover special considerations for kittens with recurring sneezing, including medical interventions, environmental modifications, and long-term care plans. Understanding chronic sneezing. Chronic sneezing is more than just occasional sniffles. It is defined as sneezing that continues for several weeks, often accompanied by nasal discharge, coughing, or other respiratory symptoms. Unlike acute sneezing caused by temporary irritants or infections, chronic sneezing may signal underlying health issues that require careful attention and management. Common causes of chronic sneezing include feline herpes virus, FHV1, infection. This viral infection can persist in the kitten system and flare up periodically, especially during stress or illness. Feline calicivirus, FCV, infection. Similar to herpes virus, calicivirus can cause recurrent respiratory issues and oral ulcers. Chronic allergies. Persistent exposure to dust, pollen, mold, or other allergens can cause long-term sneezing. Nasal polyps or growths. Structural abnormalities or benign growths in the nasal passages may lead to repeated sneezing and congestion. Dental issues. Infections or abscesses in the teeth or gums can irritate the nasal passages, resulting in chronic sneezing. Immune system deficiencies. Kittens with weakened immune systems are more susceptible to persistent infections and sneezing. Recognizing chronic sneezing symptoms. Identifying chronic sneezing early allows for timely intervention. Signs to watch for include frequent or daily sneezing over an extended period, nasal discharge that is clear, thick, yellow, or green, coughing or gagging, especially during or after sneezing, watery or red eyes, decreased appetite or difficulty drinking, lethargy or reduced playfulness. Keeping a detailed record of these symptoms, including duration and severity, will help your veterinarian diagnose the underlying cause and tailor a treatment plan. Veterinary evaluation for chronic sneezing. A veterinarian will perform a comprehensive evaluation to determine the cause of chronic sneezing. This may include physical examination, checking the nose, mouth, throat, eyes, and ears for signs of infection or structural issues. Diagnostic tests, blood work, nasal swabs, imaging, X-rays or CT scans, or allergy testing to pinpoint the source of chronic sneezing. Dental examination, identifying dental problems that may contribute to nasal irritation. Culture and sensitivity tests. If a bacterial infection is suspected, tests determine the most effective antibiotics. A precise diagnosis is crucial because chronic sneezing often requires targeted, long-term treatment rather than simple home remedies. Treatment and ongoing management. Treatment for chronic sneezing depends on the underlying cause. Some common approaches include antiviral medications. For kittens with herpes virus infections, antiviral drugs may reduce flare-ups and severity of symptoms. Antibiotics, prescribed for secondary bacterial infections, especially if nasal discharge is thick or colored. Anti-inflammatory medications, reduce nasal and throat inflammation, making breathing easier. Nasal sprays or drops. Saline solutions help clear mucus and soothe irritated nasal passages. Surgical intervention. In cases of nasal polyps, growths, or severe structural issues, surgery may be required to restore normal breathing. Dental treatment. Addressing abscesses or infected teeth reduces nasal irritation and prevents recurring sneezing. Your veterinarian will develop a long-term care plan, including follow-up appointments, monitoring, and adjustments to medications as needed. Environmental modifications for chronic sneezing. Creating a sneeze-friendly environment is critical for kittens with chronic respiratory issues. Environmental adjustments reduce triggers and support ongoing health. Air quality management. Use HEPA filters to minimize dust, pollen, and dander. Avoid smoking or strong fragrances in the home. Clean bedding and toys. Wash bedding frequently and select hypoallergenic toys to reduce allergens. Humidity control. Maintain moderate humidity levels to prevent nasal dryness or irritation. A humidifier may help in dry climates. Avoid mold and mildew. Ensure proper ventilation and clean damp areas to prevent mold growth, which can trigger sneezing. Minimize stress. Stress can exacerbate chronic sneezing, especially in cats with viral infections. Provide safe spaces, consistent routines, and gentle social interaction. Nutrition and immune support. Long-term health maintenance includes proper nutrition to support immune function. High-quality diet. Provide protein-rich kitten food tailored for growth and immune support. Hydration. Ensure fresh water is always available. Wet food can increase fluid intake and help clear nasal passages. Supplements. Under veterinary guidance, consider supplements such as omega-3 fatty acids or immune-supporting vitamins. Avoid unverified or human supplements. A strong immune system helps your kitten resist infections and recover more quickly from flare-ups. Monitoring and follow-up care. Chronic sneezing requires consistent monitoring and proactive follow-up. Track the frequency, severity, and triggers of sneezing episodes. Observe appetite, energy, and overall behavior. Note responses to medications or environmental changes. Maintain regular veterinary appointments for evaluation and adjustments to the treatment plan. Long-term records allow you and your veterinarian to detect patterns, anticipate flare-ups, and optimize care. Behavioral considerations for chronically sneezing kittens. Kittens with chronic sneezing may experience stress, anxiety, or frustration due to discomfort. Behavioral management is essential to improve quality of life. Interactive play. Maintain mental stimulation without overexerting your kitten. Use gentle, engaging toys and puzzle feeders. Safer treats. Provide quiet spaces for rest during flare-ups or when the kitten feels overwhelmed. Social support. Gentle interaction with humans or compatible pets helps reduce stress and promotes emotional well-being. By addressing behavioral health alongside physical health, you support the kitten's overall recovery and resilience. When to seek immediate help. Even with chronic management, certain situations require prompt veterinary intervention. Severe labored breathing or open mouth breathing. Thick, yellow-green, or bloody nasal discharge. Rapid deterioration in energy or appetite. High fever or persistent vomiting. Signs of pain or severe distress. Quick action can prevent complications and safeguard your kitten's health. Creating a long-term care plan. A structured, long-term care plan for chronic sneezing includes medical management. Follow prescribed medications, treatments, and veterinary guidance. Environmental control. Minimize allergens, irritants, and stressors in your home. Nutrition and hydration. Provide consistent, high-quality food and water. Behavioral support. Ensure mental stimulation, play, and social interaction. Monitoring and records. Keep detailed logs to track patterns and inform ongoing care. Emergency preparedness. Know the signs of flare-ups or emergencies and have veterinary contacts ready. By integrating these elements, you help your kitten live comfortably and reduce the impact of chronic sneezing on daily life. Conclusion. Chronic sneezing in kittens requires careful, ongoing management, combining medical care, environmental adjustments, nutrition, and behavioral support. With consistent attention, proper treatment, and preventive strategies, kittens with chronic sneezing can enjoy a healthy, active, and fulfilling life. Understanding triggers, monitoring symptoms, and collaborating closely with your veterinarian are key to successful long-term management. By implementing these strategies, you provide your kitten with the best chance to thrive despite chronic respiratory challenges. In the next and final chapter, we will provide a comprehensive summary and actionable tips for owner. Welcome to Chapter 10, the final chapter of our extensive guide on kitten sneezing. In this chapter, we will provide a comprehensive summary of the key points discussed throughout the series and offer practical tips to ensure your kitten enjoys lifelong health, comfort, and happiness. By implementing these strategies, you will empower yourself as a responsible and attentive kitten owner, capable of minimizing sneezing episodes and supporting overall well-being. Recap of key concepts. Throughout this series, we explored various aspects of sneezing in kittens, from causes and immediate care to long-term management. Here's a summary of the most important concepts. Common causes of sneezing. Viral infections like feline herpes virus, FHV1, and calicivirus, FCV. Bacterial infections leading to upper respiratory issues. Environmental irritants, allergens, and dust. Foreign objects in the nasal passages. Dental problems or other underlying health conditions. Early detection and observation. Tracking sneezing frequency, nasal discharge, appetite, and behavior. Recognizing patterns and triggers to address problems before they escalate. Understanding the difference between mild, acute sneezing and chronic or severe conditions. Home care and supportive strategies. Keeping your kitten hydrated and nourished. Maintaining a clean and allergen-free environment. Providing gentle handling and a stress-reduced setting. Using home remedies and supportive care under veterinary guidance. Preventive health measures. Vaccinations for core diseases such as FHV1, FCV, panleukopenia, and rabies. Regular veterinary checkups to monitor growth, immunity, and overall health. Parasite control through flea, tick, and worm prevention. Nutrition and hydration tailored to growth stages. Behavior, play, and stress management. Interactive play and mental stimulation to promote physical and emotional health. Safe retreats and consistent routines to minimize stress. Gentle socialization with humans and other pets to build confidence and resilience. Emergency situations. Recognizing critical symptoms such as labored breathing, thick or bloody discharge, lethargy, or sudden loss of appetite. Providing immediate supportive care at home while seeking veterinary attention. Understanding that quick intervention can save lives. Recovery and long-term health. Supporting nutrition, hydration, and medication compliance during recovery. Creating a calm, clean, and comfortable environment for healing. Monitoring symptoms and maintaining follow-up care for lasting health. Chronic sneezing management. Understanding underlying causes such as viral infections, allergies, nasal growths, or immune deficiencies. Collaborating with your veterinarian to develop long-term care plans. Environmental adjustments, dietary support, and behavioral enrichment to reduce flare-ups. Continuous observation and prompt response to worsening symptoms. Practical daily tips for owners. Maintaining a healthy, sneeze-free kitten involves practical steps that can easily be integrated into your daily routine. Here are actionable tips for lifelong kitten care. Establish a daily routine. Feed, play, and rest at consistent times to reduce stress. Monitor your kitten's energy levels and sneezing frequency each day. Ensure a balanced schedule that includes play, exploration, and quiet time. Maintain environmental cleanliness. Wash bedding, toys, and litter boxes regularly. Use HEPA filters and maintain moderate humidity to reduce airborne irritants. Avoid smoking, strong perfumes, and household chemicals near your kitten. Support nutrition and hydration. Provide high-quality, age-appropriate kitten food. Include wet food for extra hydration. Offer fresh water at all times and consider adding kitten-safe broths for variety. Encourage regular play and exercise. Interactive toys, wand toys, and puzzle feeders stimulate both mind and body. Gentle play prevents boredom, reduces stress, and strengthens immune function. Supervised exploration provides enrichment without exposure to harmful triggers. Regular veterinary engagement. Keep up with vaccinations, boosters, and parasite prevention. Schedule routine checkups to detect early signs of illness. Discuss any recurring sneezing or health concerns promptly. Observation and record keeping. Maintain a log of sneezing episodes, nasal discharge, appetite, and energy levels. Note any environmental changes or stressors that may trigger symptoms. Use this record to communicate effectively with your veterinarian. Stress reduction techniques. Provide safe, quiet spaces where your kitten can retreat. Offer consistent handling, gentle interaction, and positive reinforcement. Avoid sudden loud noises or changes in routine that may cause anxiety. Prepare for emergencies. Keep a small emergency kit including carrier, towels, saline solution, and contact numbers for your veterinarian. Recognize early warning signs that require urgent attention, such as labored breathing, high fever, or severe nasal discharge. Know the location of nearby emergency veterinary clinics. Creating a comfortable home environment. A sneeze-free, comfortable home environment is essential for both physical and emotional health. Consider the following. Designated rest areas. Provide cozy beds or covered spaces where your kitten can rest undisturbed. Climbing and scratching opportunities. Vertical spaces and scratching posts fulfill natural instincts and reduce stress. Interactive play zones. Separate areas for toys and exploration to encourage physical activity. Clean air and minimal irritants. Regular vacuuming, HEPA filtration, and avoidance of allergens prevent respiratory irritation. Temperature control. Maintain a stable, comfortable temperature to support recovery and general health. Special considerations for long-term health. For kittens prone to sneezing, consider long-term strategies to minimize recurrence. Allergy management. Identify and reduce exposure to environmental allergens whenever possible. Chronic infection monitoring. Work with your veterinarian to manage viral infections or immune-related issues. Behavioral enrichment. Maintain play, socialization, and mental stimulation as permanent components of care. Regular health assessments. Semi-annual veterinary visits may be beneficial for kittens with chronic sneezing tendencies. Promoting a happy and active life. Beyond preventing sneezing, the goal is to provide a happy, active, and fulfilling life for your kitten. Positive reinforcement, consistent care, and attentive monitoring allow your kitten to thrive both physically and emotionally. Benefits include reduced risk of illness and infection, enhanced immune system and faster recovery from minor illnesses, stronger bond between kitten and owner, improved behavior, confidence, and social skills. By integrating preventive health, environmental support, and behavioral enrichment, you give your kitten the best foundation for lifelong wellness. Final thoughts. Caring for a kitten prone to sneezing requires knowledge, patience, and dedication. From understanding causes and preventive care to managing chronic issues and emergencies, each aspect of care contributes to your kitten's long-term health and happiness. The key takeaways from this series are: observe and document. Track your kitten's health and behavior consistently. Prevent and protect. Vaccinations, nutrition, and environmental management are foundational. Engage and stimulate. Play, socialization, and enrichment support both physical and emotional health. Act promptly. Recognize emergency signs and seek veterinary care without delay. Maintain consistency. Long-term routines, monitoring, and follow-up care prevent relapses and ensure comfort. By following these strategies, you empower yourself to provide the highest quality of care, ensuring that your kitten grows into a healthy, resilient, and sneeze-free adult cat. Congratulations! By completing this guide, you now have a thorough understanding of how to manage sneezing in kittens, both in acute situations and for long-term wellness. Use this knowledge to create a loving, safe, and healthy environment where your kitten can thrive for years to come. Welcome to Chapter 11 of our comprehensive series on kitten sneezing. In this chapter, we will explore advanced care strategies, holistic approaches, and integrative health practices for kittens prone to sneezing. While conventional veterinary care is essential, complementary strategies can enhance overall health, strengthen immunity, and improve quality of life for sensitive kittens. Understanding advanced care. Advanced care goes beyond routine veterinary visits and standard treatments. It involves targeted medical interventions for persistent or complex respiratory issues, long-term monitoring and preventive health plans, collaboration with veterinary specialists when needed, combining conventional medicine with safe holistic practices. Kittens with recurring or chronic sneezing may benefit from advanced care strategies, especially when conventional treatments alone are insufficient. Specialist veterinary consultations. For kittens with persistent or severe sneezing, consulting a specialist can provide additional insights. Feline internal medicine specialists. These veterinarians handle complex cases, including chronic respiratory infections, immune deficiencies, and systemic illnesses. Veterinary ophthalmologists and dentists. Eye and dental issues can exacerbate sneezing, so specialists can address underlying causes often missed in general practice. Veterinary allergists. Chronic allergic reactions may require diagnostic testing, environmental management plans, or specialized treatments. By working with specialists, owners can access targeted diagnostics, advanced treatments, and long-term monitoring strategies tailored to their kitten's specific needs. Holistic approaches to sneezing management. Holistic care focuses on supporting the whole kitten, physically, mentally, and emotionally, rather than just treating symptoms. Safe, veterinarian-approved holistic strategies include nutritional optimization, high-quality, species-appropriate diets, supplements such as omega-3 fatty acids, antioxidants, and immune-supporting vitamins, incorporating wet food to maintain hydration and aid in mucus clearance, herbal and natural remedies. Under veterinary guidance, mild herbal supplements like chamomile or calendula may soothe irritation. Avoid any herbs or remedies known to be toxic to cats, such as garlic, onion, or certain essential oils. Environmental enrichment. Maintaining low-stress living spaces. Providing safe climbing structures, hiding spots, and interactive toys. Minimizing exposure to irritants like dust, smoke, or strong fragrances. Hydrotherapy and steam therapy. Gentle steam from a humidifier or short exposure to warm mist may help clear nasal passages. Ensure the kitten is supervised and not overheated or stressed. Acupuncture and physical therapy. In some cases, licensed veterinary acupuncturists may provide therapies to boost immunity, reduce inflammation, and improve respiratory health. Physical therapy or gentle massage can improve circulation, reduce stress, and support recovery. Holistic approaches should complement conventional veterinary care rather than replace it. Always consult a veterinarian before introducing any new therapies or supplements. Integrative health strategies. Integrative health combines conventional medicine with holistic practices to create a comprehensive, balanced care plan. Key components include preventive health planning, regular checkups, vaccinations, and parasite prevention, tailored nutrition and hydration plans, environmental modifications to reduce allergens and irritants, chronic condition management, coordinating with veterinarians and specialists to monitor flare-ups, using safe complementary therapies to reduce recurrence, tracking long-term progress with detailed symptom logs, immune system support, balanced diet with vitamins and minerals essential for immune function, stress reduction strategies, including calm routines and positive interactions, safe exposure to mild environmental stimuli to build resilience, behavioral and emotional care, regular play and mental stimulation to reduce anxiety and boredom, socialization with humans or compatible pets to build confidence, calm handling and positive reinforcement during treatment or recovery. Integrative care allows owners to anticipate potential issues, intervene early, and support kittens in a proactive, holistic manner. Managing environmental and seasonal triggers. Many kittens are sensitive to seasonal or environmental triggers that can exacerbate sneezing. Seasonal allergies, dust, pollen, mold, and plant allergens may increase during spring or fall. Humidity and temperature, dry indoor air or extreme temperatures can irritate nasal passages. Household chemicals, cleaning agents, perfumes, and scented candles can worsen sneezing. To minimize triggers, use HEPA filters and maintain consistent indoor humidity. Avoid strong fragrances or harsh cleaning chemicals. Keep bedding, toys, and living spaces clean and dust-free. Observe seasonal patterns and adjust environmental controls accordingly. Monitoring and long-term care. Long-term monitoring is essential for kittens prone to sneezing. Maintain detailed health logs documenting sneezing episodes, nasal discharge, energy levels, appetite, and environmental conditions. Schedule regular veterinary checkups to reassess treatment plans. Adjust diet, environmental management, and holistic therapies based on observed patterns. Early detection of flare-ups allows owners and veterinarians to intervene quickly, reducing severity and duration of symptoms. Emergency preparedness in advanced care. Even with advanced care and holistic strategies, emergencies can occur. Prepare a plan that includes emergency kit, carrier, towels, saline solution, medications, and veterinary contacts. Recognizing critical symptoms, labored breathing, colored nasal discharge, sudden lethargy, or loss of appetite. Veterinary network. Keep contact information for general veterinarians, emergency clinics, and specialists readily available. Being prepared ensures that kittens receive prompt care when necessary, reducing risks associated with chronic or severe respiratory conditions. Holistic lifestyle practices. Beyond direct medical care, holistic lifestyle practices promote resilience and overall health. Routine and consistency. Predictable feeding, play, and rest schedules reduce stress. Stability supports immune function and reduces flare-ups. Positive reinforcement. Reward calm, cooperative behavior during treatments or checkups. Strengthen trust between kitten and owner. Mindful observation. Watch for subtle changes in behavior, appetite, or breathing. Early intervention often prevents severe complications. Mental stimulation. Puzzle feeders, toys, and safe exploration opportunities engage the kitten's mind. Mental activity supports emotional health and reduces stress-related sneezing. The role of owners in integrative care. Owners play a central role in implementing advanced, holistic, and integrative strategies. Your attentiveness, consistency, and proactive approach can significantly improve your kitten's quality of life. Key responsibilities include administering medications and supplements as prescribed, maintaining a clean, low-stress, and allergen-free environment, tracking health indicators and communicating changes to your veterinarian, providing behavioral enrichment, socialization, and emotional support. By actively participating in care, owners help kittens not only recover from sneezing episodes, but also develop stronger immunity and resilience. Conclusion. Advanced care, holistic approaches, and integrative health strategies offer a comprehensive framework for managing sneezing in kittens. Combining conventional veterinary care with supportive lifestyle practices, environmental management, and preventative strategies enhances long-term health and quality of life. The key takeaways from this chapter include: consult specialists for chronic or complex cases. Integrate holistic practices such as nutrition, safe supplements, environmental enrichment, and stress reduction. Combine conventional and complementary care for optimal health. Monitor symptoms and adjust strategies proactively. Prepare for emergencies to ensure rapid intervention when necessary. By implementing these strategies, you can provide your kitten with a balanced, healthy, and comfortable life, reducing sneezing episodes and supporting lifelong well-being. In the next chapter, we will explore innovative therapies and emerging research in feline respiratory care, providing owners with insights into the latest advancements for managing sneezing in kittens. Welcome to Chapter 12 of our comprehensive guide on sneezing kittens. In this chapter, we will explore innovative therapies, cutting-edge treatments, and emerging research in feline respiratory care. While conventional care remains essential, understanding new developments allows owners to make informed decisions and provide the best possible support for kittens prone to sneezing. Understanding modern approaches to respiratory health. Recent advances in veterinary medicine focus on preventive, targeted, and minimally invasive strategies to address upper respiratory issues. These approaches aim to reduce chronic sneezing, enhance immune function, and improve long-term quality of life. Some modern approaches include targeted antiviral and antimicrobial therapies, novel drug delivery systems such as inhalers or nasal gels, immune-modulating treatments to strengthen natural defenses, regenerative medicine techniques to repair tissue damage. By integrating these strategies with traditional care, veterinarians can provide kittens with more effective and comfortable treatment options. Innovative medications and drug delivery. One of the most exciting areas of development is the creation of advanced medications and delivery systems. Inhaled therapies. Nebulized medications deliver antiviral or anti-inflammatory agents directly to the respiratory tract. Reduces systemic side effects and targets treatment precisely where it's needed. Useful for kittens with chronic viral infections or persistent nasal inflammation. Nasal gels and sprays. Nasal gels containing soothing agents or antiviral compounds help clear mucus and reduce irritation. Easy to administer at home with minimal stress for the kitten. Can complement systemic medications prescribed by a veterinarian. Immune-modulating drugs. New medications aim to enhance the kitten's immune response without overstimulating it. Can reduce frequency and severity of sneezing episodes caused by viral infections. Often used under specialist supervision to ensure safety and effectiveness. Regenerative and cellular therapies. Emerging research explores regenerative medicine as a way to repair damaged respiratory tissues. Stem cell therapy. Early studies suggest that stem cells may help repair inflamed or damaged nasal and respiratory tissue. Potential applications for kittens with chronic viral infections or structural nasal damage. Still considered experimental and requires veterinary supervision. Tissue engineering. Research in regenerative tissue scaffolds aims to restore normal respiratory function in cases of structural abnormalities. Could eventually reduce the need for invasive surgeries in chronic sneezing cases. While these therapies are in early stages, they represent promising avenues for future management of persistent respiratory issues. Nutraceuticals and functional nutrition. Functional nutrition, also known as nutraceutical support, is gaining attention for its potential to support respiratory health. Omega-3 fatty acids reduce inflammation in nasal passages and promote overall immune function. Antioxidants, Vitamins C and E, as well as certain plant-derived compounds, may reduce oxidative stress associated with chronic infections. Probiotics support gut health, which is linked to immune function and can help reduce susceptibility to respiratory infections. It's important to consult a veterinarian before introducing nutraceuticals, as improper dosing or unsuitable products can be harmful to kittens. Environmental and technological innovations. Advances in environmental technology are also enhancing respiratory care. High-efficiency air filtration systems. HEPA filters and advanced air purifiers reduce allergens, dust, and airborne pathogens, essential for kittens with chronic sneezing or allergies. Smart home monitoring. Temperature, humidity, and air quality sensors can alert owners to conditions that may exacerbate sneezing. Enables proactive management of environmental triggers. Automated humidity control. Maintains optimal humidity levels to prevent nasal dryness and irritation, especially beneficial in dry climates or during winter months. These innovations help create a consistent, supportive environment that reduces triggers and supports long-term respiratory health. Integrative research on feline respiratory health. Emerging research emphasizes the importance of integrative approaches combining conventional medicine, environmental management, and nutrition. Key findings include multifactorial causes of chronic sneezing. Studies show that chronic sneezing often results from a combination of viral infections, immune system status, environmental factors, and stress. Management plans should address all contributing factors, not just symptoms. Early intervention improves outcomes. Prompt treatment of upper respiratory infections reduces the likelihood of chronic complications. Regular monitoring and preventive care are critical for kittens prone to recurrent sneezing. Behavioral and stress factors. Stress reduction and environmental enrichment have measurable effects on immune function and respiratory health. Calm, predictable environments decrease the frequency of sneezing flare-ups in sensitive kittens. Holistic and complementary therapies supported by research. Some holistic therapies are supported by emerging scientific evidence. Aromatherapy caution. While certain essential oils may help with stress, many are toxic to cats. Only veterinarian-approved mild scents or diffusers should be used in kitten care. Gentle acupuncture. Small-scale studies suggest acupuncture may help reduce inflammation and promote recovery in respiratory illnesses. Must be performed by certified veterinary acupuncturists. Homeopathic or herbal support. Limited evidence exists, but some mild herbal remedies may support immune function. Only safe, vet-approved options should be considered. Practical application of emerging therapies. While many of these innovative approaches are still developing, owners can begin to incorporate elements safely. Use high-quality, species-appropriate diets with functional nutrients. Maintain clean, allergen-reduced, and humidity-controlled environments. Monitor air quality and temperature to prevent irritation. Explore safe, vet-approved complementary therapies like gentle acupuncture or approved supplements. Stay informed on new veterinary research and treatment options. By combining these strategies with conventional veterinary care, owners can maximize the well-being of sneezing kittens and reduce long-term respiratory issues. Preparing for the future of feline respiratory care. The field of feline respiratory care is rapidly evolving. Key trends to watch include personalized medicine, tailoring treatments based on a kitten's genetics, immune profile, and environmental factors. Advanced drug delivery, minimizing stress and side effects with targeted therapies. Regenerative medicine, repairing tissues damaged by chronic infections or structural issues. Integrated monitoring systems, using technology to track health metrics and predict flare-ups. These developments promise to make sneezing management more precise, effective, and comfortable for kittens in the near future. Owners' role in emerging care strategies. Owners are critical in applying new research and therapies effectively. Stay informed and maintain communication with your veterinarian. Observe your kitten closely and document symptoms and responses to new treatments. Provide a safe, low-stress, and enriched environment. Combine conventional care, environmental control, and holistic practices in a balanced manner. Your proactive involvement ensures that innovative therapies have the greatest positive impact on your kitten's health and comfort. Conclusion. Innovative therapies and emerging research in feline respiratory care offer exciting opportunities to enhance kitten health, reduce chronic sneezing, and improve quality of life. By integrating conventional medicine with safe, evidence-based complementary approaches, owners can provide kittens with cutting-edge support for respiratory wellness. Key takeaways from this chapter include: keep up with advances in veterinary medicine and emerging therapies. Collaborate with your veterinarian to safely implement new treatments. By embracing innovation, knowledge, and proactive care, you ensure that your kitten not only recovers from sneezing episodes but thrives in a healthy, happy, and sneeze-free life. In the next chapter, we will focus on preventive strategies for multi-cat households, exploring how to reduce the spread of respiratory infections, manage allergens, and maintain overall feline wellness when multiple kittens or cats live together. Welcome to Chapter 13 of our comprehensive guide on sneezing kittens. In this chapter, we will focus on preventive strategies, health management, and environmental considerations for households with multiple kittens or cats. Living in a multi-cat environment introduces unique challenges, particularly when managing respiratory health and preventing the spread of infections. By implementing careful strategies, owners can protect all cats in the household while promoting overall well-being. Understanding risks in multi-cat households. When multiple cats share a home, several factors can increase the risk of respiratory infections and sneezing episodes. Close contact, sneezing, grooming, and shared spaces allow viruses, bacteria, and allergens to spread quickly. Shared resources, food bowls, water dishes, litter boxes, and bedding can harbor pathogens if not cleaned regularly. Stress, competition for attention, territory, or resources can weaken the immune system and trigger respiratory flare-ups. Environmental contamination, dust, dander, and airborne allergens accumulate more rapidly in multi-cat households. Understanding these risks is the first step in creating an environment that minimizes sneezing and promotes health for all residents. Vaccinations and preventive health care. A robust preventive healthcare routine is critical in multi-cat homes. Core vaccinations. Ensure all kittens and cats are up to date on vaccinations against feline herpes virus, FHV1, calicivirus, FCV, panleukopenia, and rabies. Vaccinations reduce susceptibility to infections that can spread rapidly in group settings. Regular veterinary checkups. Schedule routine exams to monitor health, detect early signs of respiratory illness, and update vaccinations. Early intervention can prevent minor issues from becoming serious outbreaks. Parasite control. Implement regular flea, tick, and worm prevention programs for all cats. Parasites can weaken immunity and exacerbate respiratory infections. Quarantine for new cats. Isolate new additions for at least 2 to 3 weeks before introducing them to the household. Monitor for sneezing, discharge, or other signs of illness to prevent introduction of pathogens. Environmental management in multi-cat homes. Maintaining a clean and low-stress environment is essential to reduce sneezing and respiratory infections. Air quality. Use HEPA filters or high-quality air purifiers to reduce airborne allergens and pathogens. Maintain good ventilation while avoiding drafts that could chill kittens. Humidity and temperature control. Keep humidity at moderate levels to prevent nasal dryness. Ensure comfortable, consistent temperatures throughout the home. Sanitation and cleaning. Wash bedding, toys, litter boxes, and feeding stations frequently. Use cat-safe cleaning solutions to remove pathogens without irritating sensitive respiratory systems. Disinfect shared areas regularly, particularly during an outbreak of sneezing or respiratory infection. Resource allocation. Provide separate feeding stations, water bowls, and litter boxes for each cat. Reduce competition and stress, which can compromise immune function. Monitoring and early detection. Close observation is key to preventing the spread of respiratory infections. Track sneezing episodes, nasal discharge, coughing, appetite, and energy levels for each cat. Keep individual health logs to identify patterns or early signs of illness. Separate any cat showing symptoms of sneezing or illness until veterinary evaluation. Promptly address symptoms to prevent secondary infections or spread. Stress reduction in multi-cat households. Stress can exacerbate sneezing and weaken immunity, so managing household dynamics is critical. Safe retreats. Provide multiple hiding spots and resting areas to allow each cat privacy. Avoid overcrowding to reduce anxiety. Gradual introductions. Introduce new kittens or cats slowly, using scent swapping and supervised interactions. Minimize territorial disputes and stress-related sneezing. Play and enrichment. Engage cats in interactive play to reduce boredom and tension. Offer scratching posts, climbing structures, and puzzle toys to stimulate physical and mental health. Consistent routines. Maintain predictable feeding, play, and rest schedules. Consistency helps kittens feel secure and supports immune function. Nutrition and immune support. Optimal nutrition supports the immune system and reduces susceptibility to infections in multi-cat environments. Provide high-quality kitten and adult cat food with balanced protein, fats, and essential vitamins. Include wet food to maintain hydration, which aids in clearing nasal passages. Consider veterinarian-approved supplements for immune support, such as omega-3 fatty acids, antioxidants, and probiotics. Ensure each cat has access to sufficient food to prevent competition and stress. Managing outbreaks in multi-cat homes. Despite preventive measures, respiratory outbreaks may still occur. Effective outbreak management includes isolation. Immediately separate sick cats from healthy ones. Limit contact to reduce spread. Veterinary intervention. Seek professional care for symptomatic cats. Administer prescribed medications promptly and monitor response. Sanitation. Disinfect shared surfaces, litter boxes, and feeding stations. Replace or wash bedding, toys, and blankets. Environmental control. Increase ventilation and air filtration. Maintain moderate humidity and temperature to support recovery. Monitoring recovery. Continue monitoring all cats for at least 2 to 3 weeks after symptoms resolve. Prevent relapse or secondary infections. Behavioral considerations in multi-cat households. Behavior plays a significant role in respiratory health management. Positive reinforcement. Reward calm behavior during feeding, play, and treatment. Social hierarchies. Respect established cat hierarchies to reduce stress and sneezing flare-ups. Mental stimulation. Provide opportunities for individual exploration and group play to keep all cats engaged and happy. Long-term preventive planning. For households with multiple cats, long-term strategies are essential. Regular health checks. Schedule veterinary exams every 6 to 12 months. Vaccination schedule. Keep all cats updated on core and risk-based vaccines. Environmental maintenance. Consistently clean and sanitize shared spaces. Observation logs. Maintain detailed health records for each cat to detect early warning signs. Stress management. Continue providing enrichment, safe spaces, and consistent routines. Owners' role in multi-cat respiratory health. Owners are the central coordinators in multi-cat households. Implement preventive healthcare, vaccination, and parasite control for all cats. Monitor symptoms and intervene early to prevent the spread of illness. Maintain a clean, low-stress, and enriched environment. Coordinate veterinary care and follow-up treatment for sick or vulnerable kittens. A proactive, organized approach ensures that all cats enjoy a healthy, comfortable, and sneeze-free environment. Conclusion. Managing sneezing in multi-cat households requires a combination of preventive healthcare, environmental management, stress reduction, and careful observation. By understanding the unique challenges of group living, implementing preventive measures, and responding promptly to symptoms, owners can significantly reduce respiratory infections and promote the long-term health and happiness of all cats in the household. Key takeaways from this chapter include: ensure vaccinations, parasite prevention, and regular veterinary care for all cats. Maintain clean, allergen-free, and organized living spaces. Monitor each cat individually for early signs of sneezing or illness. Manage stress and provide environmental enrichment to reduce flare-ups. Act swiftly during outbreaks to protect all residents. By combining vigilance, preventive strategies, and thoughtful care, multi-cat households can successfully manage sneezing, supporting kittens and adult cats in achieving optimal respiratory health. In the next chapter, we will explore traveling, boarding, and social situations for sneezing-prone kittens, including how to minimize exposure to respiratory pathogens while maintaining comfort and safety. Welcome to Chapter 14 of our comprehensive guide on sneezing kittens. In this chapter, we will explore strategies for safely traveling, boarding, and managing social situations for kittens prone to sneezing. Kittens are particularly vulnerable to respiratory infections during stressful or unfamiliar experiences, so careful planning is essential to protect their health while ensuring comfort and safety. Understanding the risks of travel. Traveling exposes kittens to new environments, unfamiliar animals, and potential pathogens. Common risks include exposure to respiratory pathogens. Public transportation, boarding facilities, or friends' homes may harbor viruses or bacteria. Sneezing kittens are more susceptible to infections when immune systems are stressed. Stress-related immune suppression. Car rides, unfamiliar carriers, and changes in routine can trigger stress-induced sneezing. Stress weakens immunity, making kittens more prone to respiratory flare-ups. Environmental irritants. Dust, strong odors, air fresheners, and smoke can irritate sensitive nasal passages. Temperature fluctuations during travel can worsen sneezing episodes. Understanding these risks allows owners to plan proactively and minimize potential complications. Preparation for safe travel. Proper preparation is key to ensuring the safety and comfort of sneezing-prone kittens during travel. Health check before travel. Schedule a veterinary exam to confirm your kitten is healthy enough for travel. Ensure vaccinations are up to date, particularly against respiratory viruses. Choosing the right carrier. Use a well-ventilated, secure carrier with a comfortable bedding pad. Ensure the carrier is large enough for the kitten to turn, stretch, and lie down comfortably. Avoid carriers with strong chemical smells or harsh plastic odors. Acclimating your kitten. Introduce the carrier gradually at home with treats, toys, or familiar blankets. Allow your kitten to explore the carrier without pressure to reduce stress during actual travel. Travel supplies. Bring fresh water, wet food, and any medications prescribed by the veterinarian. Pack cleaning supplies, disposable towels, and an extra blanket in case of accidents. Include a small first aid kit and contact information for nearby veterinary clinics. Traveling by car. Car travel can be stressful, but several strategies can make it smoother. Secure placement. Place the carrier on a stable surface, preferably on the floor or secured with a seatbelt. Avoid placing the carrier in direct sunlight or drafty areas. Maintain calm conditions. Play soft music or keep the environment quiet to reduce anxiety. Avoid sudden stops or harsh driving maneuvers. Temperature control. Ensure the car is comfortably warm or cool, avoiding extreme temperatures. Check frequently that your kitten is neither too hot nor too cold. Short breaks for long trips. If traveling long distances, provide short breaks to offer water and check on your kitten. Do not allow the kitten to roam freely in unfamiliar areas, as this increases exposure risk. Air travel considerations. Flying with a sneezing-prone kitten requires extra precautions. Airline policies. Research airline rules regarding pet travel. Cabin versus cargo. Whenever possible, keep your kitten in the cabin to monitor health and reduce stress. Carrier comfort. Line the carrier with absorbent, familiar bedding. Minimize waiting times. Reduce time spent in crowded areas or airports where pathogens are more likely to spread. Boarding and pet sitting. When leaving your kitten in the care of others, proper planning ensures safety and reduces exposure to illness. Selecting a boarding facility. Choose a reputable facility with strict vaccination requirements. Ask about sanitation, ventilation, and protocols for managing sick animals. In-home pet sitting. If possible, have a sitter come to your home to reduce exposure to new environments. Provide clear instructions for feeding, medications, play, and observation. Health precautions. Ensure all cats in the facility or home are healthy and vaccinated. Avoid facilities with known outbreaks of upper respiratory infections. Comfort measures. Provide familiar bedding, toys, and scents to reduce stress. Maintain consistent routines to keep the kitten comfortable and calm. Managing social situations. Social interactions with humans or other animals can present risks for sneezing-prone kittens. Controlled introductions. Gradually introduce new people or animals in a calm environment. Observe for signs of stress or sneezing and adjust interaction duration accordingly. Hygiene practices. Encourage hand washing before and after handling kittens. Avoid sharing food, bowls, or bedding between cats unless each is healthy. Monitoring interactions. Limit interactions with other animals showing signs of respiratory illness. Provide retreats and safe spaces for the kitten to escape overstimulation. Preventive measures during social events. Even short social gatherings or visits can trigger sneezing or respiratory infections. Maintain a clean environment, free from dust, smoke, or strong fragrances. Keep kitten carriers or play areas sanitized. Observe your kitten for early signs of sneezing or discomfort. Provide frequent breaks and quiet spaces to reduce stress. Emergency preparedness while traveling or boarding. Preparedness is crucial to ensure prompt intervention in case of illness. Have contact information for local veterinarians or emergency clinics. Keep medications, first aid supplies, and a health log readily available. Monitor for early warning signs, including labored breathing, nasal discharge, lethargy, or sudden appetite loss. Act quickly to isolate and treat symptomatic kittens to prevent complications. Stress reduction techniques during travel and social situations. Reducing stress is essential for minimizing sneezing and maintaining immune function. Familiar items. Bring favorite toys, blankets, or clothing with familiar scents. Provide comfort through scent-based familiarity. Calm environment. Use quiet tones, soft music, or pheromone sprays approved for kittens. Avoid loud noises, sudden movements, or crowded spaces. Positive reinforcement. Reward calm behavior with treats and gentle praise. Gradually increase exposure to new situations over time. Consistent routines. Maintain feeding and play schedules during travel or social visits. Predictable routines reduce anxiety and support immune function. Long-term strategies for travel-resilient kittens. Building resilience over time prepares kittens for safe social interactions and travel. Gradually introduce new environments, people, and animals in controlled settings. Acclimate kittens to carriers, car rides, and short trips early in life. Maintain vaccination, parasite control, and regular veterinary care. Encourage mental stimulation and play to promote confidence and stress tolerance. Owners' role in safe travel and social experiences. Owners are the primary caregivers responsible for ensuring safe, stress-free experiences for sneezing-prone kittens. Plan ahead and anticipate potential risks. Maintain hygiene, vaccination, and preventive care. Monitor the kitten closely and intervene promptly if signs of stress or illness appear. Provide consistent routines, enrichment, and safe retreats. By being proactive, attentive, and prepared, owners can ensure that kittens remain healthy, happy, and sneeze-free even during travel, boarding, or social interactions. Conclusion. Traveling, boarding, and social situations present unique challenges for sneezing-prone kittens. By understanding risks, implementing preventive strategies, maintaining hygiene, reducing stress, and monitoring health, owners can minimize respiratory infections and promote comfort and safety. Key takeaways from this chapter include: plan and prepare carefully before travel or boarding. Acclimate kittens to carriers and new environments gradually. Maintain vaccinations, preventive care, and hygiene standards. Provide familiar items, quiet spaces, and consistent routines. Monitor health closely and act promptly if symptoms arise. Welcome to Chapter 15 of our comprehensive guide on sneezing kittens. In this chapter, we will explore how to provide seasonal care and make environmental adjustments to support kittens prone to sneezing throughout the year. Changes in temperature, humidity, and allergens can significantly impact respiratory health, so proactive seasonal management is crucial to reduce flare-ups and maintain comfort. Understanding seasonal risks for sneezing kittens. Each season presents unique challenges for kittens prone to sneezing. Winter. Low humidity can dry out nasal passages, making kittens more susceptible to irritation and infection. Cold drafts and sudden temperature changes can trigger sneezing episodes. Indoor heating may exacerbate dryness in the environment. Spring. Pollen, dust, and outdoor allergens increase, leading to seasonal respiratory issues. Sneezing may flare up as kittens are exposed to new scents, flowers, and plants. Changes in weather can affect indoor air quality and humidity. Summer. Heat and humidity can cause discomfort and stress, potentially affecting immune function. Increased exposure to dust, pollen, and outdoor pollutants may exacerbate sneezing. Air conditioning can create drafts and dry indoor air if not monitored. Fall. Mold spores and decaying leaves can increase allergens in the environment. Cooler temperatures may trigger seasonal respiratory irritation. Indoor heating begins again, contributing to lower humidity and nasal dryness. Recognizing seasonal risks helps owners anticipate challenges and implement preventive measures to protect kittens. Environmental adjustments for each season. Proper environmental adjustments can reduce sneezing episodes and support overall respiratory health. Winter adjustments. Use a humidifier to maintain indoor humidity at 40 to 50%. Keep kittens away from cold drafts and ensure cozy, draft-free sleeping areas. Use soft bedding and warm blankets to maintain comfort. Monitor heating systems to prevent excessively dry air. Spring adjustments. Regularly clean floors, carpets, and windowsills to remove pollen and dust. Use HEPA air purifiers to reduce airborne allergens. Wipe paws and fur after outdoor exposure to remove pollen. Keep windows closed on high pollen days and monitor indoor air quality. Summer adjustments. Provide air-conditioned or well-ventilated areas to maintain moderate temperatures. Avoid direct sunlight or overheating in carriers or resting areas. Use fans or gentle airflow, ensuring kittens are not exposed to drafts. Maintain clean litter boxes and reduce indoor dust accumulation. Fall adjustments. Clean and vacuum regularly to remove mold spores, leaves, and dust. Monitor humidity levels as heating systems start operating. Use air purifiers and maintain well-ventilated spaces to reduce allergens. Inspect outdoor play areas for mold, decaying leaves, or potential irritants. Daily care adjustments for seasonal changes. In addition to environmental changes, daily care routines should adapt to seasonal variations. Feeding. Provide wet food during winter to maintain hydration and soothe nasal passages. Offer balanced nutrition year-round to support immunity. Adjust portion sizes based on activity levels, which may change with the season. Hydration. Ensure fresh water is always available, particularly in dry winter months. Consider water fountains to encourage drinking and maintain mucus clearance. Grooming. Brush kittens regularly to reduce shedding and airborne dander. Clean eyes, nose, and paws gently to remove allergens or irritants. Adjust grooming frequency according to seasonal shedding patterns. Play and exercise. Provide indoor enrichment during extreme weather. Encourage physical activity to support immune function and reduce stress. Use toys and climbing structures to maintain mental stimulation year-round. Seasonal health monitoring. Monitoring your kitten's health is crucial throughout the year to catch early signs of respiratory issues. Track sneezing frequency, nasal discharge, coughing, appetite, and energy levels. Keep records to identify seasonal patterns and adjust care routines accordingly. Observe behavior changes, such as hiding, reduced play, or restlessness, which may indicate discomfort or illness. Preventive measures for seasonal allergies. Seasonal allergies can trigger sneezing in sensitive kittens. Preventive strategies include indoor air management. Use HEPA filters, air purifiers, and regular ventilation to reduce allergens. Keep windows closed during high pollen or dust days. Cleaning and sanitization. Vacuum carpets, rugs, and furniture frequently to remove allergens. Wash bedding and blankets regularly in hot water. Wipe down surfaces, toys, and carriers to reduce environmental triggers. Outdoor exposure management. Limit outdoor play during peak pollen times. Rinse paws and fur after outdoor exposure to remove allergens. Use safe, veterinarian-approved wipes or damp cloths for cleaning. Nutrition and supplements. Provide high-quality food with immune-supporting nutrients. Discuss veterinarian-approved supplements for allergy or respiratory support. Stress reduction across seasons. Stress can exacerbate sneezing and weaken immunity. Seasonal changes may contribute to stress, so proactive management is essential. Maintain consistent routines for feeding, play, and rest. Provide multiple safe spaces for retreat and privacy. Use pheromone diffusers approved for kittens to promote calmness. Gradually acclimate kittens to environmental changes, such as new scents or temperatures. Emergency preparedness for seasonal flare UPS. Even with preventive care, seasonal changes may trigger sneezing episodes or respiratory issues. Keep emergency contacts for veterinarians and local clinics readily available. Maintain a travel or emergency kit with medications, first aid supplies, and carriers. Monitor symptoms closely and seek prompt veterinary attention for severe or prolonged episodes. Owners' role in seasonal care. Owners play a critical role in ensuring seasonal adjustments are implemented effectively. Monitor environmental conditions and adjust humidity, temperature, and air quality accordingly. Adapt daily routines, feeding, and grooming to seasonal needs. Observe kittens closely and respond to early signs of respiratory distress. Maintain vaccination, parasite prevention, and preventive healthcare schedules. By taking a proactive and attentive approach, owners can minimize seasonal flare-ups and support long-term respiratory health in sneezing-prone kittens. Conclusion. Seasonal care and environmental adjustments are vital for protecting sneezing-prone kittens throughout the year. By understanding the unique challenges each season presents, maintaining a clean and comfortable environment, adapting daily routines, and monitoring health, owners can reduce sneezing episodes, prevent infections, and ensure comfort and well-being. Key takeaways from this chapter include: recognize seasonal risks and their impact on respiratory health. Adjust indoor environment, humidity, and temperature according to the season. Maintain daily care routines, including feeding, hydration, grooming, and play. Implement preventive measures for allergens and environmental irritants. Monitor health closely and respond promptly to symptoms. Reduce stress and provide safe, consistent routines for your kitten. By integrating seasonal strategies with year-round preventive care, owners ensure that their sneezing-prone kittens remain healthy, happy, and comfortable in every season. In the next chapter, we will explore long-term health planning and holistic wellness, focusing on strategies to support kittens throughout their growth into healthy adult cats. Welcome to Chapter 16 of our comprehensive guide on sneezing kittens. In this chapter, we will explore long-term health planning and holistic wellness strategies to support sneezing-prone kittens as they grow into healthy adult cats. By combining preventive health care, environmental management, nutrition, and emotional well-being, owners can help kittens thrive and minimize chronic respiratory issues throughout their lives. The importance of long-term health planning. Long-term planning ensures that kittens receive continuous care and attention, reducing the risk of chronic sneezing, infections, and other health complications. Sneezing-prone kittens may have ongoing sensitivity to allergens, viruses, or environmental irritants, making consistent health strategies crucial. Key components of long-term planning include preventive healthcare, regular veterinary checkups, vaccinations, and parasite control. Environmental management, maintaining a clean, safe, and stress-free home environment. Nutrition and supplements, providing balanced diets and immune-supporting nutrients. Stress reduction and emotional well-being, supporting socialization, mental stimulation, and confidence. By addressing these areas, owners can help kittens maintain strong immune systems, reduce flare-ups, and enjoy a higher quality of life. Preventive healthcare strategies. Preventive healthcare is the cornerstone of long-term wellness for sneezing-prone kittens. Regular veterinary exams. Schedule routine checkups every 6 to 12 months to monitor growth, health, and vaccination status. Early detection of minor respiratory issues prevents escalation into chronic conditions. Vaccination protocols. Maintain up-to-date vaccinations, particularly for feline herpes virus, FHV1, and calicivirus, FCV. Consider risk-based vaccinations based on lifestyle, travel, and exposure to other cats. Parasite prevention. Use veterinarian-recommended flea, tick, and worm prevention products consistently. Parasite infestations can weaken immunity and exacerbate respiratory problems. Dental health. Regular dental checkups and cleanings prevent infections that may indirectly affect respiratory health. Provide dental toys or treats approved for kittens to maintain oral hygiene. Monitoring growth and development. Track weight, energy levels, and behavior patterns to identify early warning signs. Adjust care routines based on developmental stages and seasonal changes. Holistic nutrition for respiratory wellness. Nutrition plays a vital role in supporting long-term respiratory health and immune function. Balanced diet. Provide high-quality, species-appropriate food with adequate protein, healthy fats, vitamins, and minerals. Wet food can aid hydration and mucus clearance, particularly for sneezing-prone kittens. Functional nutrients. Omega-3 fatty acids reduce inflammation in nasal passages and support immunity. Antioxidants, vitamins C and E, as well as plant-based compounds, reduce oxidative stress. Probiotics support gut health, which is closely linked to immune function. Avoiding harmful ingredients. Limit exposure to artificial additives, excessive fillers, or allergens that may trigger sneezing. Monitor reactions to new foods and introduce changes gradually. Seasonal adjustments. Adjust hydration and nutrient intake based on seasonal environmental changes. Increase immune-supporting foods during high-risk allergy seasons. Environmental and lifestyle management. Long-term wellness also relies on maintaining a safe, clean, and stress-free environment. Air quality and ventilation. Use HEPA filters, air purifiers, and regular ventilation to reduce airborne pathogens and allergens. Monitor indoor humidity, particularly in winter or dry climates, to prevent nasal dryness. Safe retreats and enrichment. Provide hiding spots, elevated areas, and quiet spaces for relaxation. Include climbing structures, puzzle toys, and interactive play to support physical and mental health. Multi-cat household considerations. Minimize stress by providing separate feeding stations, litter boxes, and resting areas. Monitor social interactions and intervene if any cat shows signs of stress or aggression. Routine cleaning. Maintain clean bedding, litter boxes, feeding areas, and toys. Reduce exposure to dust, pollen, mold, and other environmental irritants. Stress reduction and emotional well-being. Stress is a major factor in triggering sneezing episodes and compromising immune function. Long-term wellness strategies should focus on reducing stress and supporting emotional health. Predictable routines. Maintain consistent feeding, play, and rest schedules. Predictability reduces anxiety and supports immune function. Positive reinforcement. Reward calm behavior with treats, toys, or affection. Avoid punishment or negative reinforcement, which can increase stress. Socialization and interaction. Gradually introduce kittens to new people, animals, and environments. Encourage confidence and reduce fear-related respiratory flare-ups. Pheromones and comfort items. Use feline-friendly pheromone diffusers or sprays to promote relaxation. Provide familiar blankets, toys, or clothing with your scent for reassurance. Integrating complementary and holistic therapies. Holistic approaches can complement conventional veterinary care. Acupuncture and acupressure. may help reduce inflammation and support respiratory function. Must be performed by certified veterinary professionals. Herbal and nutraceutical support. Certain safe herbs and supplements may support immunity and respiratory health. Always consult a veterinarian before introducing new products. Mind-body connection. Recognize that mental well-being affects physical health. Play, enrichment, and positive interactions contribute to long-term respiratory resilience. Seasonal and environmental adjustments for holistic wellness. Holistic wellness requires adapting care routines to seasonal changes and environmental conditions. Adjust indoor humidity and temperature to reduce nasal irritation. Monitor allergens, pollutants, and seasonal irritants. Maintain consistent nutrition, hydration, and preventive care year-round. Reduce stress through enrichment and environmental management. Long-term monitoring and record-keeping. Tracking health over time allows owners and veterinarians to make informed decisions. Maintain a detailed log of vaccinations, medications, sneezing episodes, diet changes, and behavioral observations. Record environmental adjustments, seasonal triggers, and response to interventions. Share logs with your veterinarian to optimize care plans and treatment strategies. Owners' role in supporting long-term wellness. Owners are the central figures in promoting lifelong health and well-being for sneezing-prone kittens. Implement preventive health care consistently. Provide safe, clean, and enriched environments. Maintain balanced nutrition and immune support. Reduce stress and support emotional well-being. Monitor health and intervene promptly when issues arise. By taking a proactive, holistic approach, owners can ensure that kittens not only recover from sneezing episodes, but also grow into healthy, resilient adult cats with strong immune systems and optimal respiratory health. Conclusion. Long-term health planning and holistic wellness are essential for managing sneezing-prone kittens. By integrating preventive health care, environmental management, balanced nutrition, stress reduction, and complementary therapies, owners can support kittens in achieving optimal respiratory health, emotional well-being, and overall longevity. Key takeaways from this chapter include: consistent preventive health care and veterinary checkups are crucial. Maintain a clean, safe, and enriched environment for all kittens. Provide balanced nutrition and immune-supporting nutrients. Reduce stress and support emotional well-being through routines, enrichment, and positive interactions. Monitor health closely and keep detailed records for long-term management. By embracing a holistic long-term approach, owners can help sneezing-prone kittens thrive throughout their lives, minimizing respiratory issues and promoting happiness, comfort, and resilience. Welcome to Chapter 17 of our comprehensive guide on sneezing kittens. In this final chapter, we will summarize key lessons, provide actionable tips, discuss common pitfalls, and answer frequently asked questions to help owners confidently care for sneezing-prone kittens. This chapter serves as a practical reference, ensuring that you have the knowledge and tools to maintain your kitten's health, comfort, and happiness. Key final tips for caring for sneezing-prone kittens. Prioritize preventive health care. Keep vaccinations, parasite control, and routine veterinary checkups up to date. Early intervention can prevent minor sneezing episodes from developing into serious infections. Maintain a clean and allergen-free environment. Regularly clean bedding, litter boxes, toys, and feeding areas. Use HEPA filters and air purifiers to reduce airborne allergens. Monitor humidity and temperature to prevent nasal dryness and respiratory irritation. Implement stress reduction strategies. Provide safe retreats, hiding spots, and vertical spaces. Maintain consistent feeding and play routines. Use pheromone diffusers or sprays to promote calmness. Nutrition and hydration. Feed a balanced diet suitable for kittens with immune-supporting nutrients. Ensure access to fresh water, particularly during dry or warm seasons. Adjust nutrition seasonally or as recommended by your veterinarian. Monitor health closely. Track sneezing frequency, nasal discharge, coughing, appetite, and energy levels. Maintain health logs to identify patterns, triggers, and response to treatments. Act promptly if you notice any unusual symptoms or changes in behavior. Safe socialization and interaction. Introduce new cats, animals, or people gradually. Limit exposure to sick animals or environments with high pathogen risk. Reward calm and positive interactions with treats and affection. Travel and boarding preparation. Acclimate kittens to carriers and travel gradually. Maintain hygiene, vaccination, and preventive care during boarding or travel. Provide familiar items and calm environments to reduce stress. Seasonal adjustments. Modify environmental conditions, nutrition, and care routines according to the season. Monitor allergens, humidity, temperature, and other seasonal factors. Take proactive steps to minimize flare-ups during winter, spring, summer, and fall. Holistic and long-term wellness. Incorporate enrichment, play, mental stimulation, and emotional support. Consider safe complementary therapies under veterinary guidance. Keep detailed records to track health, growth, and seasonal patterns. Emergency preparedness. Maintain contact information for veterinarians and emergency clinics. Keep a first aid kit, medications, and supplies ready for travel or home emergencies. Know early warning signs of serious respiratory issues, such as labored breathing, lethargy, or persistent discharge. Common pitfalls to avoid. Even experienced cat owners can make mistakes that exacerbate sneezing or compromise kitten health. Avoid these common pitfalls. Delaying veterinary care. Waiting too long to address sneezing, nasal discharge, or lethargy can lead to more serious complications. Always seek professional guidance at the first sign of unusual symptoms. Neglecting environmental cleanliness. Failing to regularly clean bedding, litter boxes, and feeding areas increases the risk of infections. Accumulated dust, pollen, and dander can worsen sneezing episodes. Overlooking stress factors. High-stress environments, overcrowding, or sudden changes can trigger respiratory flare-ups. Monitor social dynamics and provide adequate personal space for each kitten. Ignoring seasonal adjustments. Treating all seasons the same may expose kittens to allergens, temperature extremes, or low humidity. Adjust indoor conditions, nutrition, and routines according to seasonal needs. Improper nutrition. Feeding low-quality food, ignoring hydration, or introducing abrupt dietary changes can weaken immunity. Balanced nutrition and proper hydration are essential for long-term health. Inadequate travel or boarding preparation. Skipping carrier acclimation, travel practice, or boarding research increases stress and infection risk. Prepare thoroughly and maintain consistent care during transitions. Over-reliance on medications alone. While medications are important, they should complement preventive care, nutrition, and environmental management. Holistic wellness strategies help reduce dependency on frequent interventions. Frequently asked questions, FAQs. Q1. How can I tell if my kitten's sneezing is serious? A. Occasional sneezing is common, but persistent sneezing with nasal discharge, coughing, labored breathing, lethargy, or loss of appetite requires veterinary attention. Early diagnosis prevents complications. Q2. Can allergies cause sneezing in kittens? A. Yes. Environmental allergens like dust, pollen, mold, or strong fragrances can trigger sneezing. Reducing exposure, maintaining clean spaces, and monitoring seasonal changes help manage allergic reactions. Q3. How often should I clean my kitten's environment? A. Bedding, litter boxes, and feeding areas should be cleaned at least weekly, with toys, blankets, and surfaces wiped down regularly. High-risk environments may require more frequent cleaning. Q4. Are certain breeds more prone to sneezing? A. Some breeds, particularly brachycephalic cats like Persians or Himalayans, have shorter nasal passages, making them more susceptible to respiratory issues. Extra care and preventive strategies are recommended for these breeds. Q5. What vaccinations are essential for sneezing-prone kittens? A. Core vaccines include protection against feline herpes virus, FHV1, calicivirus, FCV, panleukopenia, and rabies. Risk-based vaccines may be recommended depending on your kitten's environment and exposure. Q6. Can stress really trigger sneezing? A. Yes. Stress weakens the immune system and may exacerbate existing respiratory sensitivity. Providing consistent routines, safe retreats, and positive interactions reduces stress-induced sneezing. Q7. How do I manage multiple kittens with sneezing issues? A. Separate affected kittens, maintain clean and separate resources, monitor health closely, and reduce stress through safe spaces and enrichment. Quarantine new additions until they are healthy. Q8. What should I do if my kitten sneezes during travel? A. Keep the kitten calm, ensure proper hydration, avoid drafts, and monitor symptoms. If sneezing persists or is accompanied by discharge or lethargy, seek veterinary advice promptly. Q9. Can diet help reduce sneezing episodes? A. Balanced nutrition, hydration, and immune-supporting nutrients help strengthen defenses and reduce susceptibility to infections. Avoid sudden dietary changes and allergenic ingredients. Q10. How can I support long-term wellness? A. Implement preventive healthcare, maintain a clean and enriched environment, provide balanced nutrition, reduce stress, monitor health closely, and consider holistic or complementary strategies under veterinary guidance. Actionable summary for owners. To successfully care for sneezing-prone kittens, plan preventive care, keep vaccinations, parasite control, and checkups up to date. Maintain clean environments, reduce allergens and pathogens in all areas. Reduce stress, provide safe spaces, enrichment, and predictable routines. Optimize nutrition, feed balanced diets and ensure hydration. Monitor health, track symptoms and respond promptly to changes. Prepare for travel and boarding, acclimate kittens and maintain care standards. Adapt seasonally, adjust indoor conditions, diet, and routines based on seasonal challenges. Consider holistic approaches, support physical and emotional well-being through enrichment, mental stimulation, and safe complementary therapies. Conclusion. Caring for sneezing-prone kittens requires vigilance, planning, and a holistic approach. By implementing preventive strategies, maintaining clean and enriched environments, reducing stress, monitoring health, and adapting care to seasonal and environmental changes, owners can help their kittens thrive. This final chapter has provided practical tips, common pitfalls, and answers to frequently asked questions, equipping owners with the knowledge to confidently support their sneezing-prone kittens. Remember, early intervention, consistent care, and attention to both physical and emotional well-being are the keys to ensuring long-term respiratory health and overall happiness. By combining everything you've learned across these chapters, your sneezing-prone kittens can grow into healthy, resilient, and happy adult cats, ready to enjoy a lifetime of comfort, play, and companionship.